Got a lot of people waiting. That's good.
Yeah. We're streaming somewhere.
There we are.
Okay. Yeah, there we are. All right.
A lot of people waiting. Good. Okay.
Turn this volume off. There we go.
Well, that was a cluster.
Yeah, it was a cluster. New way of doing things.
Hey guys, we are live, and let's start from the top like we should have.
And now something completely different.
Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
Well, welcome back, Mr. Tillman.
Welcome back, Mr. Kobren.
It's nice to be here. I have to say that, and guys, thank you so much for hanging out while we're getting our issues together. I hear a little bit of could be my headset. I think the sound is okay now, Joe, right?
Yeah, sounds good on my end.
Okay. I think it's been about 7 weeks since we've done a live broadcast. And I want to welcome everybody, and I want to thank you guys for being so patient while we're dealing with everything that we've been dealing with during these pretty insane, historically just fucked up times. Now, I will say this. It's interesting because I just cursed. There's been a lot going on behind the scenes in this field. And I've been doing, and we have been doing, Joe included, a tremendous amount of work to try to really, I don't want to say hasten the evolution, but to kind of restart or get to the point where the field is actually back to an evolution instead of devolving the way that it has been. So for the past 6 or 7 weeks or so, we have been working on putting together a pretty significant milestone of a conference that has caused a stir that, frankly, I can't really wrap my head around. What we're creating is a platform for physicians who are already in the field and physicians around the world who are either just dabbling, who are considering getting into the field, who are in the field, who maybe just bought a turnkey device and are kind of lost, to really get the information they need and the education that they need to perform this surgery, not only to state-of-the-art standards, but really to provide consumers, patients, with a positive experience. This is such a life-changing, difficult, elegant, nuanced form of cosmetic surgery that I certainly do not believe, based on all of the results that are coming in the last few years especially, that there's adequate training and that there is adequate education being provided by the current entities that are supposed to be providing it in this field. So what we decided to do is put together really the first ever, I guess, extremely well-produced and put together virtual conference in this field. It's incredibly inexpensive. We've had some really great mainstream partners to come along with us. And because we are doing this, or I should say I'm doing this, because no one gives a shit what Joe does, apparently. They love the guy.
Apparently.
Yeah.
I can't even force it.
But it is a mission, it seems, for the politicians in this field, who incidentally are physicians for the most part, who are supposed to be treating you guys, to somehow block our efforts to educate physicians on a larger scale. We currently have over 1,000, as of today, over 1,000 physicians who have subscribed for registration to this event, making it the largest event in the history, or it should be, the largest event in the history of this field, as far as an educational resources event and a conference.
I think that alone deserves a congratulations. So well done.
Well, I appreciate that. Look, none of it counts until the check clears. That's how I look at it. But that's an expression, guys. Relax. Don't take that out of context.
Kobren's making money on this.
But that'd be great if we actually can. But the point is to really move in the direction where we're evolving this field. Remove all the politics. I think it's my headset, actually. It's not sounding great. Remove all the politics and just create an environment where the bureaucracy is gone, where it's really a meritocracy. Those who are part of the faculty, those who are part of what we're doing, those who are educating others, are educating them based on the merits of their experience, as well as, even if they are not quite as experienced as far as time on tissue, they may offer something unique as far as they have a unique skill set. They have experience that maybe some of these older guys have not seen yet. They have their own personal experiences. You know, I have guys who are part of the faculty here who have had hair transplants, who have been fucked up before, who want to help to provide perspective to their colleagues about what it's like to be in that position and then treat patients based on that perspective. Some of the faculty that we have would never be allowed to speak at some of these conferences that are well known in our field because they're not part of the whole, in my view, the cronyism aspect of this field.
It basically comes down to, you know, they're involved simply because there is value in their experience, whatever it may be, and it does, you know, it's based on what they bring to the table, not whose ass they kiss.
Yes, absolutely. Now, it's great if they're all kissing ass. That's fine, whatever. You don't have to kiss my ass, though, to be part of what we're doing. And I don't want to get into particulars because this is not about the politics, but I think it's in politics, but I think it's important for consumers to understand what we are trying to do to change this field. It is a lot of hard work and effort. And frankly, you know, based on last week's experience, I think that the term or the phrase, evil works hardest before the dawn, has never been more fitting.
Ooh, good one. That's true.
Than in what I've seen these politicians and these administrators of organizations who, by the way, get paid, their personal companies get paid exorbitant administration fees from a nonprofit. But you know, that's neither here nor there. There's nothing wrong with that. That's just the reality. Well, I don't know. I mean, there is something wrong with it if you're being hypocritical about it. But with that said, I've never seen physicians and a group of so-called educators work so hard to completely quell or squash the evolution and education of other doctors who are going to have the lives of patients in their hands tomorrow, the next day. They're already marketing their new, you know, Neograft or Artis or their new, you know, wall device or whatever they're marketing. They just picked up this thing and they're going to town on people's heads, and no one gives a shit.
Well, not only it actually goes beyond that. There are people actively trying to prevent their education.
Yes.
Blows my mind. The response that we've received from this, like if someone had just told me this offhand, I wouldn't have believed it. But to see it with my own eyes, it was a sit down and scratch my head moment. Like, what the hell are wrong with people?
Well, listen, I know what happens behind the scenes, and that's cool. You know, I mean, it's not cool. It's fucked up, but it's the way that it is. But to actually put what they put in writing,
Yeah.
I think it really underscores not only their naivete as a whole, and
on many levels,
and frankly, stupidity. I hate to say it. That sounds like I'm somehow bashing whoever wrote this email. But they are putting their organization and themselves in tremendous potential liability. And I don't even understand why that would be the case. And I'm not talking about liability from what I'm doing or me personally. I'm talking about in the eyes of physicians, all these guys who've written me, who sent me these emails. They have completely lost any enthusiasm or respect for those running this organization. That's the liability that I'm talking about. Forget about the actual and actionable liability. That's beyond stupidity.
That's a whole different ballgame.
Yeah. But that day, when that was sent to me, I noticed that the day prior to that, all of a sudden we were getting like subscription after subscription after subscription. I'm like, what's going on here? We didn't post anything new. We didn't post any updates to the program. So I can only assume it's because of that email. And then when we posted the program, which is an incredible program as far as regenerative medicine is concerned as well, we got a tremendous amount of interest, which is amazing to me. So for all of you guys out there who are listening to this saying, what the fuck is Spencer talking about? What I'm talking about is we're creating and facilitating in a manner in which it was never done before, the ability for physicians to actually truly get an education in this field before they work on your heads. And I can say, after doing this for almost 23 years, that has really, in my view, never fully existed, because what is being put out there is very limited. There's no true fellowships. If a physician is working in their own hometown, there's another guy gives them a call and says, hey, listen, I happen to be in, Los Angeles. I'd really love to come by and check out your work, and maybe you can help me. I'm starting a practice. The answer would be like, yeah, I'd love to help you, but you know what? Now you're my competition. Can't happen.
Yeah.
That is going to end. This is medicine. There are no trade secrets in this trade. That's what I never understood about this. This is medicine.
Yeah.
To hold trade secrets. I've even spoken to really well-known guys who go out and speak at these conferences who have told me, and this happened in Europe when I was at FEU Europe, said to me after a couple of drinks, I was expressing how I was really impressed at how much he was willing to share. And he said, well, I haven't given all my secrets away. That was I'm like.
It's like, what?
In my mind, I'm like, just let me give you the compliment and at least make believe you're being, genuine.
Yeah.
Anyway, so Joe, I mean, I hope that I didn't go on a crazy rant about this, because there will be people who say, Kobren, he's bashing us again. I am just stating the obvious and letting the consumer know how insanely evil so many in this field are, and that they are not looking out for the best interest, in my view, of the patient. And all they give a shit about is control and power, which they have none of.
They have, well,
You just froze.
I will say this.
You just froze. They're essentially grasping at smoke. No? Okay, you're good now.
Okay. Yeah, don't tell me I froze. I was just holding still. Where was I? Yeah, I won't say that it's complete evilness. I think there's a serious lack of situational awareness of their own industry, and they've forgotten the basic tenet in medicine that you need to share what you learn. You need to share it with your colleagues for the betterment of the field and betterment of patients.
Yes, and there's a bizarre focus on certain things that are inconsequential, as opposed to the actual focus, which should be this field and physicians in this field and who are part of these organizations have turned a blind eye to the damage that was being done by many of the leadership in that field and those who are part of these organizations who are not getting adequate training. And they've turned a blind eye to that because they believe that what's really important is maintaining and growing their organizational structure and bureaucracy.
Mm-hmm. And how better to do that than to discourage the use of technicians in surgery and promote the exclusivity of doctor-only performed surgery. That's
100%.
the only way to do that.
100%.
Yeah.
Now, I definitely do not, and that's something that I think is important for everyone to understand out there. We do not support the practice of medicine or aiding and abetting the practice of medicine without a license. But if it's legal in your state or province for technicians, medical technicians, or surgical technicians to be a part of that surgery, whatever the aspect is, then that's the way that it is. This is how this industry has been run since its inception.
Mm-hmm. Since the very beginning. And for there to be a push for this type of delineation, techs versus doctors, it is completely ignoring the fact and even endorsing the fact that there are, we'll say ignoring the fact that there are countless doctors that if they were to pick up a punch, or even while they are picking up a punch, they do supremely horrible work, but it doesn't matter because they are a doctor doing the horrible work, not a technician doing fantastic work. And that is an absolute crime, the way I look at this. Again, as long as the technician in whatever clinic is performing, it's legal for them to do this, then it is a crime to promote the horrible work of a doctor that doesn't know what he's doing versus the technician that may be able to put out stellar results.
But also, but the hypocrisy for me is this. If you were to look at any state's scope of practice for surgical or medical assistants who are not PAs or nurses, handling live tissue, a live organ, and manipulating that live organ would not be within their scope of practice. Putting a live organ back into someone's body would not be in that scope of practice. Why? What is the difference currently? What is the argument? This has been permitted and allowed and given a thumbs up by the states for decades. If you don't think that is an important part of the surgical process, if you don't think that trimming an organ, even if it's outside the body, and manipulating that organ isn't surgery, or a major part that impacts the surgical outcome, then you're crazy. But I can tell you what, inserting something back into the body could be considered a surgical procedure. I can tell you that.
Mm-hmm. Yeah.
So, guys, all I can say is 2020, while it's an insane year, it's going to be a great year for hair transplant surgery. And it's going to be a great year for those who are considering having surgery to really further educate themselves and become more aware of what's going on out there before they take that step. Now, what we say always here on this show is that surgery is a last resort. That's the truth. And no matter what organization someone belongs to, even if they are members of the International Alliance of Hair Restoration Surgeons, you can always get fucked up. Depends on the day. It depends on your physiology, depends on how the PAs or the nurses feel that day, or the technicians feel that day, or the doctor feels that day. That is the reality. You can do your research from today or tomorrow. You can have recommendations from every Tom, Dick, or Harry. You can have recommendations, or you can find someone on a website that is very well respected, and you can still get fucked up. And that is a message that everyone is afraid to tell you. The phone number is 888-659-3727. That's 888-659-3727. We're going to take a call, and I felt that it's been 7 weeks. I had to get that off my chest. But I will say, guys, this is my favorite part of this job. Favorite part. I miss it immensely because everything else is like I'm in the fucking Twilight Zone. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Hello? Hey, caller. I could hear.
Hello?
I hear something. All right, man. Call back. Guy's been waiting. 667 area code. Phone number is 888-659-3727. Guys, call in. Again, this is a live broadcast. Well, it's my favorite thing to do. If we go live and we don't get any phone calls, and we had all lines lit, and then I guess my monologue was a little too long. You dropped off. Call back. I want to make sure the phones are working as well because I have not used them in a while. It's 888-659-3727. Go ahead, Joe.
I was just going to say Mark Napier was trying to say he can't get through. He was getting the please call back message, and I told him that means all lines are busy. So he's welcome to try and call back again. I think it was Mark Napier. Yeah, Mark Napier 31.
Well, let's see who this is.
Okay.
It's a New York number. Hey, you're on the air. Who's this? Where are you calling from?
Hey, it's Morty from Brooklyn.
Morty, man. It could always depend on you, man. Thanks. Well, at least we know the phones are working.
Guys, yes, they are. Guys, thank you for putting the show back on. You're lifesavers. You're a port in the storm, and I appreciate you guys more than you know.
Well, we appreciate you too, man. I appreciate you saying that. So what's been going on with you, man?
Well, I kind of sent you some text. So I had planned at the beginning of the year, before all this craziness happened, to do some regenerative medicine procedures on my scalp with Dr. Cole. I had planned to do it for February, and then it got pushed to March, and then COVID. At that point, I basically had canceled it, and then I pushed it, and then in June, when things looked like we were in a good lull, I scheduled for this coming week, and then of course the world exploded, which is where we are right now, and I had to cancel again.
What do you mean?
What do you mean?
Well, what happened basically was that. I mean, have you guys been living under a rock? Our good governor basically told us that we can't travel.
No, I've been living in Canada.
Yeah.
Yeah.
I have to say that you're probably pretty lucky at this point.
Yeah. So
sorry to interrupt, Morty. Go ahead.
Push it off again. No, that's okay. You guys always do, and I always interrupt you, so that's fine. But basically, I had to put it off again, and it's very demoralizing. So
really, what's more demoralizing? The city that you're living in, and having to live under that rain, or not being able to get your PRP or whatever you're going for?
Yeah, well, it was interesting. They'd actually become very good friends with Dr. Cole. He actually came up to New York in January. I got a chance to meet face to face with him. We had some drinks, we had some dinner, and he's a really good guy. And so I agreed to basically do what he's calling a cocktail. So it's a combination of exosomes.
Of course, he's calling it a cocktail.
Yeah,
I'm just kidding.
It'll even have a little umbrella on the top, in a tiki glass with some 151. It's exosomes plus liposomal stem cells plus I guess whatever else he's going to throw into it. So that was kind of what I had scheduled. I paid for it already, and I just wanted it over with. And we had that lull in May. The whole country, with everything was going down, and then now we're in this explosive state that we're in right now. So it all had to be postponed yet again. Yeah, I guess you could say that it's a good thing. I'm just kind of annoyed because I just wanted to put this behind me.
No, I get that.
The other thing is, yeah,
it's frustrating as hell. And listen, I mean, we are living in.
Yeah.
I mean, I'm not even going to get into the politics of it or any of it. I don't want to even get into any of it. But all I can say is, I never believed that in my lifetime I would see what has happened to this world and to this country.
Mm-hmm.
Yeah, let's not go there. Let's talk about hair.
Yeah.
So, you say that it's a good thing that I postponed. So one of the things that I've been trying to get information out of when I called in to cancel was the state of affairs for some of these regenerative medicine techniques, things like exosomes, which now it's been probably well over a year since they kind of hit the scene. And I'm very curious to know what you guys have heard in terms of perhaps longer-term effects of this, whether or not they're getting more, like whether it's been considered settled science. Is it better than PRP? Is it the same? Does it have the same longevity? Does it have the same effect? What have you guys heard? Is there any news around that?
Well, I'll tell you what I've heard. And the two people that I've spoken with who have used it the longest in their practices, they both are no longer doing a combination of PRP and exosomes. Not that it's detrimental anyway, but a lot of they feel that it's as effective, and they also let's put it this way: they want to kind of test out to see if exosomes alone would be as effective as PRP with exosomes. But there are a handful of guys, and there's a couple of guys that I know, one here in Los Angeles, that's doing both. And in his practice, he is seeing significant results and relatively long-term results, and he's been doing it for a while. This is the doctor, and I'm not out here to pimp anybody, but this is the doctor that actually performed the procedure on the doctor in Texas who has been promoting exosomes a lot. And this guy, he did have PRP and exosome combination, and his growth was significant. And I mean, we're talking about an older gentleman, guy older than me, who had significant growth. In this particular doctor's practice, he's seeing the same thing long term. And I mean, what I mean by long term, in over a year, when patients are coming back. And it seems like patients, if they do have a combination, this sounds confusing, of PRP and exosomes, it seems like they don't have to go back for the PRP, at least according to the people that I've spoken with, as often. So,
it clears mud.
I'm seeing not quite as positive long-term outcomes or hearing about them, but on the flip side, I'm not hearing anything contrary to that either. It's just any of the doctors I've not even asked about it, honestly, because I'm waiting for them to be so excited they can't wait to tell me. And a couple of doctors I was talking to early on, one was saying that, yeah, I'm pretty much dropping PRP out of my practice because at the very least, exosomes are as good as my PRP. And his PRP was really good to begin with.
And you don't have to draw blood.
As PRP goes. Yeah, you don't have to draw blood. But he was saying that it's looking like it's better. At worst, it's as good as PRP. So that's the most I've heard about it, and that was before COVID, and there hasn't really been much talk about it since COVID, because obviously people aren't coming back in for checkups, and people are thinking about other things. But nothing bad, but nothing really new that I've heard.
Well, I actually had the opportunity to sit down face-to-face with a physician who's performing it on a regular basis, who was the first physician to perform it on this doctor who's out there really promoting it now. And, he is, he told me point blank that it's a game changer in his mind, in his practice, and that people have been able to avoid having surgery because of this, because of exosomes and PRP.
That's been my hope, and that's kind of why I wanted to go that route. I actually, you guys know, I did try PRP, and it really didn't do much, and so that's kind of why I'm like, okay, let's.
But how do you know? I mean, when I look at you and you show your images, I mean, you've definitely grown hair.
Yeah, no, I don't disagree. There's definitely been hair there, but again, I mean, mine's not probably a good example case because of the fact that I'm doing lots of other things besides.
Right.
I've got I'm doing a topical. I'm doing, I did some microneedling. I'm using the finasteride tablets. So I mean, I've got a lot going on. So you're right in the sense that there may have been some impact, but it wasn't like, how can I put it? It wasn't miraculous, I guess you could say.
Here's the reality is most of these treatments are being used to retain or to continue or reverse the miniaturization process of hair that's already there, that's still there. To get the regrowth that you got from topicals or microneedling mixed with PRP is pretty unusual. I mean, you are atypical as far as what you've been able to accomplish.
I appreciate that. But anyway, that's kind of the only real main question. The main reason I called was basically just to thank you guys for coming back and to admonish you for staying away for so long.
Yeah, well, you know what? And first of all, I appreciate that. And I have to tell you that I have to blame Joe for not doing the show. And no, partially.
I'll take it. Yeah.
But I will tell you that it is absolutely the most, let's say, the happiest time that I have in this field is being behind this mic and speaking to you guys. Because I've been doing this, like I said, for a long time. And when I'm away from my communication with our listeners and our fans and, directly being able to hear the voice of potential consumers and patients, and you dive into the darkness of this field, it could be depressing. If I'm going to be honest with you. I mean, you don't want to know. I'm glad that you're friends with John. Don't make friends with other guys in this field. Don't have too many hair transplant doctor friends, because that shit's going to bring you down. That's all I'm saying. This is a crazy field. All right, man.
Yeah.
You take care of yourself.
Take it easy, man.
Okay. Bye-bye.
All right.
Bye. Happy 4th, by the way. I hope you're celebrating, because I am. Take it easy. 888-659-3727. That's 888-659-3727. Let's see who this is. Hey, man, you're on the air. Who's this and where are you calling from?
Hello?
Hello.
All right. Man, been trying to reach you guys for a while. This is Adam calling from New York.
Adam from New York. How are you?
Hello,
And I'm sorry that you're in New York.
It's an honor to be speaking with you both.
The honor is all ours.
Thank you very much.
I've been listening in, I guess, about a month now, trying to do my research. So last fall, here's a backstory. Last fall, I had bone marrow transplant for cancer, for blood cancer.
Wow.
So I had chemo with that. Yeah.
How old are you?
So 52.
52, okay.
Okay.
Yeah. And so I know what it's like to be bald. Saw it, not into it. So the hair grew back, except the hairline, which was really weakened,
right,
and diffused, and so that really sucks. And so I've been trying since then. When I see all the hair growing, all around the sides, everything growing in nice and full, except for the hairline. So I'm like, that's when I started to see what I can do. But
when did you have your? And again, we have to preface this by saying we're not physicians. But when was your last chemo treatment?
In October. I did it for a week, right before they give me the new stem cells from a donor.
Okay, and
since
so October. So I mean, that's what, 7 months ago, 8 months ago.
Yeah, something like that.
All right, and when did your hair start to grow back?
I would say maybe December. Little fuzz started to come in. Now, when I have now, as of like today, if I put some Topic in the hairline, it doesn't look so bad.
Yeah.
But that's bogus. So, but I'm dealing with that for now.
Well, let me ask you this: did you notice any diffuse hair loss or any type of hair loss or a slight recession in your hairline before you had chemo? You did.
So So I had always wondered about that. As getting a little older, it was maturing. My brother and I would always look at each other, check out our hairlines, and make fun of each other. There's no real male pattern baldness in our family, but I always kept noticing it was kind of moving back a little bit, but nothing like this, And so after the chemo and everything's going back in, I'm left with this, really weakened hairline. So I've had some consults with some surgeons. Some are kind of part of your organization, and some are not.
Well, just to be clear, there's a lot of good guys, or not a lot, but there's a few good guys who never even apply to the IHS for whatever political reasons or whatever. So just because they're not part of what we do doesn't mean that they're not good.
Right, I assume so. I mean, I've had some consults with some surgeons who aren't part of your group, and they're really, they seem really, really good to me.
Good.
But one of them said, he emailed me. He said, "I believe that this is genetic male pattern baldness. I've seen this a number of times in patients post chemo. They have underlying male pattern baldness, and the stress from the chemo accelerates the time frame and causes the loss earlier. You were genetically destined to lose this hair regardless, but it probably would have happened in a more gradual and longer progression without the shock to the system."
Is that a New York doctor?
Yeah.
Okay. To me, it sounds like it might be Bob Bernstein.
No.
Doran.
No, but I did have a consult with True.
Okay.
True or Doran, I forget which one of them. And so that made me wonder because, when I was around, let's say, 15 years ago, I was taking Propecia, just like, maybe I can get ahead of this maturing hairline, And then I had a kid. We were trying to have kids. So I stopped taking it, and I never went back on it, thinking everything was okay. I mean, I just had other things going on.
Sure.
And I didn't have any side effects from it. But now I just started on the 1st of July on Canada Day, Joe, an asteroid.
Mazel tov.
To see what happens, because what I'm trying to do is to do a transplant this fall. So it'll be a year after my stem cell transplant, and the doctor would clear it if all goes according to plan.
Well, first of all, I'm glad. First of all, I'm glad that you're doing well and that you're here to talk to us about this. I will say that, and I'm going to let you answer. I'll answer any questions, or we'll answer any questions that you have. But I would say that if you do well on finasteride, it's possible. I'm not saying it's going to happen, but it's possible that you could get to where you were pre-chemotherapy.
Or close enough where surgery is not necessary.
Yeah, or close enough where surgery really isn't necessary. So you really should give it some time.
I'm hoping. Well, that's why I'm starting now, so that all of July, August, September, that will be 3 months.
Which is not enough time.
It's not enough,
just so you know, it's not enough time.
How much time is needed?
I would say this. Look, I was an early responder, so I saw a change at the 3-month mark, but you may not, and you may not see anything that's significant to you for 6 months or more, especially since your hair is really just starting to grow in after chemotherapy. So I'm pretty sure Joe is going to tell you got to wait a year, but I know you don't want to wait a year.
Yeah, no.
Well, I was going to say wait a minimum 6 months just to see a change, because as Spencer said, he was an early responder at 3 months. You won't be. Right. You might be, but don't expect that you will be. Expect to see something maybe by 6 months, but give it a full year. If you see something at 6 months, consider that encouragement, but not by any stretch of the imagination the end point of your development, because the improvement curve actually continues for up to 2 years before it plateaus, statistically. 6 months before you can even at least see something, but a year before I think it's safe to make a decision to pull the trigger on surgery or not.
I would have to agree, and I would say that you said something interesting, that you put a little topic in or concealer in, and you're good to go, but it's fake, or it's not whatever term you used. I don't know, I said false, but if you're able to live, bogus. If you're able to live your life and feel comfortable in your own skin right now, you're married, you have children, all this stuff, Are you still married?
No.
Okay, you're not. So you're trying to get yourself out there. Well, let me tell you something. At our age, I'm older than you. At our age, it doesn't, trust me. I mean, if you tell someone, hey, what you've been through, and that you're using these fibers because of that, first of all, they're not going to think twice. But even if it was just common male pattern hair loss without dealing with what you've dealt with, no one's going to give a shit. I'm telling you, that is the truth. You will. But to rush into the surgery now, before you know where you stand, I can tell you that it could be a mistake. You can deal with shock loss. Mm-hmm. You can be so far worse than you are right now if things don't go right.
Mm-hmm. Yeah, I was going to ask you that when, I know you've covered this a bunch, I'm sure.
It's okay.
When even earlier on someone else's call, you said, like, anything can go wrong,
Yes.
And so I guess, some of the stuff I'd like to think won't go wrong. Like these doctors that I'm speaking with are experienced. They're not going to put, multiple grafts in the hairline. They all seem to, on their clips, have really good, single, hairline.
Everybody puts their best foot forward. Every clip, every video, every tutorial, every YouTube video is going to be fucking fantastic. But the guys that are currently in a fetal position because they believe that their lives have been destroyed by these doctors are not the cases that you see. Now, you have to deal with the averages. The physicians that we work with, on average, have the most consistently great results out there. That's it. But there is not a doctor who is part of the organization that I founded that does not have at least one unhappy patient or more. Mm-hmm. That is reality. And no one tells you that. There's no organization in the world who would tell you that except for us.
Yep.
Yeah.
In your case, I believe if you just have a recessed hairline now and you're able to cover it up or to camouflage it well enough where it looks natural using Topic, you're really not a surgical candidate. Because your loss could be so far worse than what you're dealing with right now. And Propecia, because that hair was just essentially did not grow back, it wasn't miniaturized. It probably wasn't miniaturizing for that long, or if it was, it probably was less than 5 years. There is an opportunity for you to grow some of that hair back.
Right.
So I think patience is key, and maybe look, I'm sure you're grateful for where you are right now, but also be grateful for the hair that you have at 52. Because
I hear what you're saying. I just like part of this is, I'm coming back from the dead here.
Sure.
I want to get going.
I get it.
I want to make some moves. I look way young for my age. I've been dating women 15 years younger than me. Like I'm chomping at the bit to get back out there and fix everything and fix what I can't, what I think I can,
which means that you're prime for. That means that you're primed to make a mistake.
You are the most
you're chomping the bit.
Yeah, you're the vulnerable candidate.
Yeah, absolutely.
You're the guy that someone
the first
could
doctor
say,
that says yes, you'll pull the trigger.
You're the guy that people are waiting to come through their doors.
Yeah.
Okay.
Now, listen, and I'm saying this. I just spoke to a physician who was part of my organization for a very, very long time. He decided to move over and kind of not work with me based on some political issues because we're out there now in this person's mind taking on the educational aspects of this surgery in a way that he's unhappy with. Let's put it this way. But he said something to me very interesting. And what he said was, if I say this, actually, he's going to know. But I can tell you this. Even some people that you think are the greatest guys in the world are looking for those leads. And all they're concerned about, no matter what organization they belong to, is getting people through the door. And at this stage, especially since business has been essentially gone or eradicated for months, you will have physicians will be more attentive. they will respond to you more personally more than ever because they want that bit. They need that business. And I think less, in my view, and based on some recent things that have transpired, will be as, let's just say, candid with you as they should be. So I want to prepare anyone, especially a guy in your position. You're 52 years old. You've been through a lot of shit already. To get a quarter of an inch of your hairline back and to risk real depression. Because once you're cut, man. There's no turning back.
Absolutely.
Yeah. And I don't mean to bum you out, but this is the information that you need to know.
I'm going to have to look into the shock loss and see if I can find, what that could look like and how bad that is.
Joe, why don't you tell him how bad it could be?
No, I know you've done
really bad.
Yeah.
There's nothing you're going to find. You can look into anything. You can talk to the best doctors in the world, and they're all going to tell you, "Well, this is rare," and you can expect this. You can't expect anything. Every human body is different. We respond differently, and everybody on that surgical day is going to be different. Now, chances are, if you go to someone who's really good, who has a lot of experience, and they believe you're a candidate, the chances are high that you're going to do well. But say they're 95% that you're going to do well and 5% that you're going to be fucked up. Are you willing to risk that 5% chance of being fucked up?
I hear you. I don't. All these surgeons, they've been quoting me around the 1,500, 2,000 range. Like, it's not a ton that I need.
It's what? It's not a what?
I don't need a ton of grafts. According to these guys, they're all, they're saying somewhere around maybe 1,700 to 2,000.
And that's for your that's for your first surgery, by the way.
Exactly. That they didn't finish the sentence. You don't need a ton of grafts
now
yet. Yeah.
Right. Meaning because things go wrong, or obviously if I start.
No. As you continue to lose more hair, or if they screw up and you've got permanent shock loss.
Right.
Either one. Now, if you're the perfect storm, everything works out, all the hair grows, and you have no shock loss, and you do well on Propecia, you're going to go out there, and you'll be the big swinging dick out there in a single scene again. But if you have even 50% of your expectations, that could affect your life.
Right.
So while every member of my organization that's listening to the show right now is like, shut the fuck up, Spence. Come on. We need the business. I need to tell you the truth. And you know what? Honestly, the guys that are involved with what we do, they know that my whole thing is to let patients know that surgery is a last resort. And at 9 out of 10 patients that I tell, I can't talk them out of surgery. But I want you to know that these possibilities exist. And just be prepared for them if you make the decision to move forward.
I hear you. But Joe, I remember you saying you started when maybe your first transplant was a very small amount just to see how many transplants in did you get shock loss?
I'm sorry, wait. No, back up to the first thing. I said what?
Didn't you? I think I heard you say once on another clip that you did 9 or 10, but one of them was really just a very small amount to see how it would work. Right? Did you not ever say that? Did that ever happen?
I think that was when I was a guinea pig for body hair back in 2006 or 5.
Okay.
Yeah.
Okay.
Yeah, I've never. Oh, okay. And then one time I laid down on the OR table so Dr. Hassan could take out 50 FUE from my scalp. That was a test. Things like that. But I've never actually gone into a hair transplant expecting to have any sort of improvement as an experiment. Like everyone I've documented has been to have some sort of improvement, however small. Like the last one I did, it was only 600 grafts, but it made a huge difference for my crown as far as the consistency of the coverage. And it was a very targeted procedure, right? So. And then I had a couple other procedures, like I had a scar revision, which I include in that number of procedures I've had, where it was simply a scar revision, but there's maybe 150 grafts that were taken out with the scar, and of course those were utilized as well. Place somewhere. I don't remember where they're placed. So yeah, little things like that. But I've never gone into a procedure just to test it out before I get more. Maybe you could qualify that BHT body hair case as that, because I would have done more if it worked out better. But yeah, I don't really advocate going in for test sessions because, you know, the idea of test sessions was pretty popular. There are a couple of idiots on various forums that were pushing the idea of
Don't
50,
make me laugh, by the way. That was
50.
hilarious.
You know what I'm talking about.
Yeah, that was great timing.
I think it was
too.
like
yeah.
I think it was like 500 graft test cases on a Norwood 6. First off, a 500 graft case on a Norwood 6, like what are you going to do with that, right? It's like you're going to spread it out over and just say, oh, I suddenly grew some peach fuzz? Or are you going to put it into like a smaller area so you can see a definite change and then have to explain away this fucking unicorn of hair coming out of your head? It doesn't make sense. But then the other problem with doing something like that is a 500 graft procedure has no bearing on how a 2,500 graft procedure will work out. You can't tell what's going to happen. You can't, like the visible or invisible scarring that you have from, can go one way or the other, from 500 grafts has zero impact on how it's going to turn out if you do one that's 2,500 grafts. It's a completely illogical approach. And the guy that was pushing this, there was one guy in particular was pushing this, he didn't think past first base on this. So it tells me that he would be really bad at chess, if you know what I mean. But it's just an absolutely horrible way to approach hair restoration, doing little tests. You either do it or you don't.
Right.
And in fact, the more tests you do, the higher the probability that something's going to turn out badly, because it's a law of diminishing returns, right? Like something's got to break. When it's an imperfect procedure on an imperfect subject, something's going to bump into that wall and fall apart. And you don't know which one it's going to be.
Mm-hmm. All right. Can I just throw a few quicker questions at you guys? Thanks for your time.
I don't know, dude. Yeah, go ahead.
I don't know. Should we? Right. Okay.
Just I've been really nerding out on all this stuff and really just fascinated by all the info I've been collecting, and it's like totally brand new. So one of the doctors that I saw, one of your guys, said that he could do, I've always been thinking FUT anyway, not FUE, just for better survival rate of the hair, and I have very fine hair. He said he would work into the diffused hairline, but I wouldn't have to be shaved. I've seen clips where people have like receding, like widow's peaks, where you shave around the sort of, the triangle in the front. I don't have that. So he would work within, Joe, I emailed you about this from your site, but I guess, I don't know. Anyway.
Well, just so you know, that was the MO of, when, before, I would say, the lateral slit technique, and before, Victor Hass and Jerry Wong really emphasized, and Joe, you can correct me if I'm wrong, the importance of shaving in order to be able to place grafts, more, closer together, and to be a little bit more accurate and more safe. Yeah.
That's what I thought.
Without transecting hairs. However, for years, hair transplant surgery was done without shaving. And there are people who have the skill set and are capable of placing grafts in between hair, existing hair. The problem is there's a greater chance of at least seeing the shock loss if you're not shaving, which can cause a tremendous amount of anxiety. And if you do have, say, just shock in that area, you're going to look worse. You're going to look a lot worse with a full head of hair surrounded by an island of freshly grafted and non-growing implants or grafts. So it could be, no matter what, even if someone says they don't have to shave your head and you can look fine, you're probably going to have an ugly duckling stage for a minimum of 4 or 5 months.
Yeah, I think that's a given. But the thing about shaving versus not shaving, the majority of clinics out there just don't shave, but they will also do a smaller session. Like like Haas and Wong, when they're arguing for shaving of the scalp before a procedure, that's talking about 4,000 grafts, 5,000 grafts, whatever. But even they will accept, or they did when I worked there, cases of 2,000 and 2,500 without shaving. They just didn't want to advertise it because they don't like doing it. It's difficult. It's time consuming. It takes longer to do stuff like that. But any doctor that is regularly not shaving the recipient will tell you that there is a threshold of what they will accept for diffuse thinning and what they won't accept, because any hair restoration surgeon that is ethical and recognizes the limits of their own abilities will say, okay, well, if it was a little bit thinner, then maybe I could go in and not risk transection, but this is a little bit too thick. So let's try non-surgical methods to try and build this up even further and try to hang on to it. But I can't touch it surgically until it's thinner. So you got to make the choice. But yeah, I think that I think the argument is valid on both ends, because I've seen, like, some of the doctors I work with, like Dr. Cooley, he doesn't really shave the recipient area, and he does good sized sessions, and that's the way he's always been. And you look at the results, it's like, if it's one or two, that's not enough, but he's got dozens and dozens of results online where he didn't shave, and it looks fantastic. There's no appreciable difference or what can I say, degradation of the appearance. It's always looking much better in the end. So
I have a direct question for you. How much of your hairline, or in inches or centimeters, how far has your hairline receded in your estimation?
One of them, I have the notes from one of the docs. I think it's like the front third, is diffused,
Did it give you a Norwood classification?
Yeah, I can look it up. I think he said a 4A, but I think that's wrong. I mean, it's not exactly a 4A, because I don't think it goes that far back.
Well, I mean, it depends. If they check for miniaturization that far back and they see miniaturization, that's,
I mean, this was over with pictures, right? So I haven't done an in-person one yet, and I'm looking to do one in-person one soon. Anyway.
Have you had an online consultation with anyone who's asked you to purchase a inexpensive digital microscope?
No. Nope.
Yeah, because, I mean, honestly, you can't see your miniaturization in certain areas using one of these plug-in, inexpensive digital devices.
Right. Well, a lot of these doctors are back up and running during in-person consultations, so I'm going to circle back, with that. But he blew me. This one doctor, I was blown away. I didn't know that was okay to do, like cut it, place around the diffused hair. But he's one of your guys, and he seems to be really reputable.
Well, listen, like I said, I mean, it's something that's been done since the beginning of hair transplant surgery, and this was the standard for many, many years. And especially if he's been around for a long time, he probably has a lot of experience with it. But I mean, 4A is pretty significant. I mean, that means you're solid in the back, solid on the sides, and you're diffusing all the way up, basically to the center of, almost close to the vertex of your head.
I think it's the front third. But anyway, not that far. But that's why I think there's a discrepancy there.
So here's the problem, and again, I could tell that I cannot talk you out of the surgeries, but here is the problem. If you do suffer with shock loss, and they put 1,500 grafts into that area, if you are truly approaching a Norwood 4A, then you can end up losing all of that veneer of hair that you currently have.
Right.
Could you live with that?
Nope.
All right. There's your answer.
Nope. That's my answer. Well, now since if you're dissuading me from getting a transplant, then I start to think about all the things that I should probably try to do along with the finasteride, and get into that whole scene with like minoxidil and derma rolling and these other.
Why don't you just see how finasteride works?
Why don't you see how it looks shaved?
He knows how. He just had
I know how it
chemotherapy.
was solved. I had chemo. It all fell out.
No, that doesn't mean you shaved it. I mean, it doesn't automatically mean that it was shaved or it looked shaved. Like sometimes it's just kind of patchy. So was it completely like? Did you lose every strand of hair?
Yes.
Okay, all right.
But also you probably had no eyebrows as well, right?
Exactly.
My
I was going to
eyebrows
say.
I kept my eyebrows.
You did.
I don't know
Okay.
why.
Okay.
That's good.
All right.
Well, listen, I certainly understand. I would look like Kane from Kung Fu, and you're old enough to know who that is, and the other character. And that is certainly not for me. Now, just to let you know, I've been living with paint on my head for at least 15, some odd, maybe 20 years now, with using Dermatch. And I'm not saying that it's ideal. I'm not saying that I love doing it, but I can have surgery with anybody in the world. And I choose not to because I know what the downside is when you have as much hair, when you've saved as much hair as I have. And also, from what you're telling me, you still have a lot of hair. So if, God forbid, things change, I don't mind painting a little bit more, because I've had to add a little bit more to the process every morning. But if things change, then I have the option. I know that they're going downhill, so then I could take that opportunity. But right now, to me, in your position, your first line of attack is medical treatment. I'm not a doctor, but that's my opinion. Medical treatment, which you're doing, and just wait a little longer. Give yourself at least 6 months, please.
Right. Yep. I hear you. Appreciate it.
And also give finasteride time on its own.
Yeah.
Because you're not going to know what's working. You want to make sure you're taking medication that's working for you.
The sitting phase, right? That's in the 3 month phase, right? 3 months, window usually, right?
You never know. I mean, you may not shed at all ever.
Right.
Yeah.
Okay.
So you just
the brand is Camber. Doesn't really matter as long as you stick to one brand. Yeah.
Well, that's what we don't know. I mean, if the brand, if you don't see a positive result, then my advice is to talk to your doctor about switching the brand name. If you see a positive result, you want to stay in that generic for as long as you can.
Right.
All right, man? Listen, I'm glad that you're healthy. That's obviously most important. You have a lot of options.
Of course.
But if you can live your life with some topic in and still get away with it and look good, appreciate that, because a lot of guys can't, especially our age.
Right. I hear you.
All right, man. Good luck.
Thanks, guys.
Take care.
All right, take
Bye-bye.
care.
Thanks for calling.
Bye.
888-659-3727. We'll take another call.
Okay.
I mean, did we try hard enough to talk this guy out of surgery or what?
I don't know, actually. So caller, the guy that just called in, just don't have surgery. There we go. Now we did it.
I think it definitely. He sounded a little bummed out when we told him the reality of things, but
he did.
That's what we do.
He did.
Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from?
Hey, Spencer. It's Destin from Arkansas.
Oh my God, Destin! Happy belated birthday, man.
Hey, man. Thank you for remembering. That's awesome.
What's up, man?
Dude, I'm like a steel trap, my man.
Happy belated.
Yeah, thank you, Joe. I wanted to let everyone know I just got back actually a week ago for my PRP treatment in Florida. So I had it delayed because of the whole COVID situation and trying to delay travel, but I figured if it's kind of not going anywhere, so I figured if I'm going to do it, I just might as well maybe do it now and just get it over with, right?
Wow, okay.
Yeah. So it was really good. It was, I think this was my 11th treatment.
Jesus.
And,
wow.
But it's good though. Everything looks good. In fact, I'm sending you a picture right now, Spencer, I think through Messenger, so you can see. I showed this to Dr. Greco. This was my picture. I had a 2007 picture and one I took in like 2018 just to compare, and you could see a huge difference. I mean, so all the work I did with finasteride and all the work that I did with PRP and everything, I think I've had incredible results. So, so it's been really, really good. It was good to catch up with Dr. Greco. Yeah. So you're seeing the picture?
Yeah.
Yeah. So you can. I mean, I think that was, what, 2007 compared to 2018?
I mean, this picture of 2018 is a little dark, but I can just see the line, the hairline. It definitely looks like it's improved pretty significantly. I mean, you were losing it, dude.
Yeah, absolutely. I remember, it's funny, going back down memory lane, I was in college, if you remember, and the week I started, figuring out that I'm losing my hair, I found the American Hair Loss Association, found your name, and found the show, and I'm like, did as much research as I could possibly do, and I was throwing the kitchen sink at it, but no, man, the result that you're seeing was a lot because of your show. I would have never found Dr. Greco. I would have never found any of that stuff if it hadn't been you interviewing him back in, 2009. And I said, you know what? I'm going to pull the plug. I'm going to go down there and get it done. And you can see the result, man. So,
listen, I'm really happy for you, and I'm glad you've been a long-time listener, and I appreciate that we've been able to help you. The one thing that I regret about, well, we were able to help you. The one thing that I regret about having Joe on the show back then, when no one was doing PRP, is that every Tom, Dick, and Harry started to do it. And PRP became the biggest money grab in this industry when people didn't know what the fuck they were doing. And so many guys, unfortunately, went to cosmetic surgeons and plastic surgeons and dermatologists, all claiming to do PRP because all of a sudden, they were seeing more and more of it online and, started off with our broadcast. And they saw this was a way for vulnerable hair loss sufferers to walk through their doors and for them to charge them $1,000 to $1,500 and now up to $5,000 for a treatment that is useless unless you are using the right equipment and you know what you're doing. So I'm glad that you found Joe Greco, and I'm glad that you're having great results. But I still think about what's going on, and even what's happening today is just, it's sad to me that people still online, you can't really decipher PRP, one type of treatment from another. And you're just very lucky to see Joe. And I know that was kind of like a rant and maybe a little bit of a ramble, but I guess I've been faced with so much bullshit this last month or so from the industry, and everyone just trying to make money from all of you vulnerable cats. It's just, it's discouraging. So to hear a story like yours it's great, and I'm glad that we were able to help.
Yeah, no, thank you. It was really interesting. I think the telltale sign was that, Greco, I think, was the pioneer with PRP. He was the really one that was, in my opinion, was experimenting really with it and had the early results. And so I was looking at him. And,
he was.
And even though I'm going through him for years and years, he's always kind of like taking me back and said, hey, come to my office. Let me show you what I'm doing now. Look what we're looking at. When I see Dr. Greco, and I'm like, he's really on the forefront a lot of this stuff when it comes to stem cell therapy, and he's having good results in a lot of things. So I think he's definitely pushing the envelope. And some of the things you were mentioning before of applying like exosomes and stuff with PRP and that stuff, he's definitely been like looking into that. So overall, like I just see a lot of positivity for him. He's genuinely excited about the science. He's got a very scientific mind, and I'm just thankful that I found him. And so it's been really rewarding for me. I know you've seen my Facebook pictures and my family, and
How old are your kids? You have 2 kids, right?
2 kids.
Wow.
Yeah, it's crazy. Yeah, I have one that just turned 4 and another one that just turned 1. So a little boy and a little girl. So.
Jesus, I cannot believe it. So how old are you now?
My birthday was actually July 1st. I just turned 33. So you knew me when
you were like 18.
I was 18 in college in a dorm room, and if you remember, it was stick-am days back then.
I do remember. It's amazing how I don't age and you guys get so old. Crazy.
But if you remember, I think you would have the webcam feature, and I'd be like, whatever girl I was with at the month or whatever, and I'd be laser combing, no problem. I'm like, hey, I got to do my hair stuff, and I'd make them listen to the show and learn about hair loss, and it's kind of weird, but
no, but you were actually it was amazing how open you were at such a young age, and how you had no concerns. There were, before you met your wife, there were other girls in your life, and you would have them on camera.
Yeah, Yeah, and
it was
we
awesome.
having a laser to him and everything. Yeah, wasn't embarrassed about it. I'm keeping my hair, and I said, this is how I'm going to do it. I'm listening to the show. I'm going to see what they're on the forefront of what's going on with technology, with all the research, and I followed the forum really heavily and said, you know what, I said, hey, if you want me to keep looking this good, I'm going to keep watching this show. So that was my...
Well, I also think that what you were able to do is you were able to avoid surgery. You know, you took the steps needed and you were willing to get on finasteride. And listen, back then you really didn't, the horror stories and the hysteria wasn't out there yet to this level online. And, you know, you were able to get yourself on it. You weren't concerned about the potential side effects. You weren't horrified by all of the fear mongering, and you're a success story. I have a question for you. As a young guy, I mean, you're still young. What do you think about these new subscription services where you can get finasteride essentially online?
Interesting.
Like Hims and Keeps and stuff like that.
Yeah, so I haven't looked too much into it personally. With me, the way that I did it, at first, and you're right, when I started back in the day, that was before all the persistent side effects. And if I had known that beforehand, all the different stuff, I might have been a little bit more hesitant. But I'm thankful that stuff didn't come out till afterwards. Because if you remember, I mean, I've lowered it down, but I was taking at one point like 7.5 milligrams of finasteride a day.
Yeah.
Plus, and then I went on.
So was I, though. I remember it because I was at one point too.
Yeah,
well.
and you hear stories, and I'm taking all this finasteride, I'm popping it like candy, and you have people that took a half a pill once, and now they've been like completely disabled. It seems like for months and months.
Well, what are your thoughts on that? Do you believe that's a possibility, or do you think I'm being completely objective where you stand right now, not based on our opinions through the program or any other information that you have? From what you read, do you think that this is a possibility, or do you think that some of it or a lot of it could be psychosomatic?
I think more of it's psychosomatic. I'm not saying it's not possible, and I'm not saying it doesn't happen genuinely, but I do know, because when we have, let's say, peer-reviewed, double-blind, placebo trials, you have people in a placebo group, even the suggestion of things, there's outcomes from that. That's with any type of control study that they see. They have reactions to the placebo group similar to the treatment group when nothing's potentially changed.
I mean,
and
clinically, at least the initial data showed that it was almost the exact amount of people during clinical trials that suffered with these adverse sexual side effects as those who were on the actual drug.
Exactly. And so, to me, I think there is some sense of power suggestion. I'm not saying it doesn't affect some people. I don't know if it's as wide as what they're saying it is now. But to me, I mean, it's hard. I know everyone's not equal and everyone's not the same. But I was popping this thing like candy, and I still take, I think, 5 milligrams a day, and then I take once a week a dutasteride tablet. And that's only because of the long half-life, right? So when I'm looking at all that, and some people just take one pill only for 1 milligram for a few weeks, and they're having these persistent side effects.
No, I have a question for you, though. Did you continue taking the drug while you had children? I mean, when you were trying to have children?
Yeah, so the way that I thought about it, and maybe this is maybe a little too graphic and everything, my wife is one, like, if you sneeze, she gets pregnant.
Right.
So she is very, I mean, it every time that we tried to have a kid, like, immediately, the first try, she got pregnant.
Right.
And which is interesting, because I was concerned with, like, before we had our first child, when we said, okay, we're going to start trying, I was like, well, there is some people that say that they have trouble conceiving after, taking this drug. But for me, it was the total opposite, right?
Yeah.
So what I did, I think, when I was a little reluctant on the dutasteride because I knew finasteride was studied a little bit more with that. So what I would do is that, okay, when we're conceiving, we would do it. But then afterwards, if any time we would have sex afterwards, I'd make sure that I use, a condom or some type of protection, because from what I understand, it's like the 17th or 18th day of gestation or whatever, fertilization, when that happens, that's when, there could potentially be a side effect. So that's what I've read. I wasn't sure how accurate it was, but I fathered my 2 kids with no issues. I just made sure that after the conception happened, I just wore a condom for the rest of the time.
Yeah.
So
Well,
that was my thought process.
That actually was a little too graphic, but I'm just kidding. But I think it's important for people to hear this because there's a tremendous amount of misinformation and a lot of, concern out there. Now, I always suggest, just based on, I think it's the responsible thing to do for me to put it out there, that if I were to decide to impregnate somebody, which I'm not deciding to do, I would get off the drug because I've been on it for so long, and try to work within a window if possible. But I know just about, every parent that I know in my life is on finasteride, and they all impregnated their wives while they were on finasteride, and they've had male children. No one has ever had, and there's no there's no data out there that indicates that there's any possibility to have these potential birth defects in that manner. But I understand the reality of, like if something did happen, would you always be thinking that it was because you were taking finasteride?
Yeah, no, there was a big concern. I'm not gonna lie. Before we had my two kids, I was definitely concerned about that possibility, and so I think that was me potentially being over precautious by saying, okay, well, if we conceive, I get off the finasteride and I'll focus and make sure, make sure there's protection only when you're ovulating, basically. So that was my thought process. But fortunately, it was for both of them, like the very first time. So there were no issues, and I was thankful for that because I was concerned. But if that had happened, I can understand. Yeah, I don't think it'd be really, really hard to forgive myself. I wouldn't want.
The thing is, you wouldn't know. You wouldn't know what, if there was any type of adverse, effect to the kid. You would think, was it because I was on finasteride? People wouldn't think that if they were on heart medication or if they were on some other medication. So it's definitely been kind of like put into our heads, into our psyche that that's a possibility. So for me, that's why I always tell people, listen, just so that you feel completely confident, get off the drug. But I'm glad, obviously, everything, you're a smart kid. It's important that people know that there's plenty of people on finasteride having children, having no issues, conceiving. And you've come a long way, kid. You're 33 years old and you're married, you have a family. I know that you're successful in your work life. And your hair looks great. So I'm really happy for you, man.
Well, I appreciate that. Thank you so much for that, man.
All right. Well, listen, have a good 4th of July. I hope you're celebrating.
Yep.
All right, dude. Listen, take care. Happy birthday.
All right. Thank you.
Bye-bye.
Bye.
888-659-3727. We'll take a call. Joe's busy doing something. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Hey, man, you're on the
Spencer.
air. Yes.
Spencer, how you doing? This is Pat calling from Ireland.
What's your name? Pat? Pat from Ireland. How are you, man?
How are you?
I'm okay.
Very good.
That's great to hear. It's great. It's great to get a call from your part of the world, man.
Yeah. Thanks very much. Thank you. I just wanted to call in. I've been listening to your show for about a year now, and I just wanted to share my hair loss journey so far with you.
Yeah.
I'm 39 years of age, and I'm turning 40 at the end of this year, and I'd say I started losing my hair when I was about 19.
Wow.
And at the time, I was washing, the usual. You'd wash your hair. Next thing, you're shampooing and you see the clumps of hair coming out, like the more hair, losing hair.
Yeah,
and I'm one of the guys now that has had the rough experience, you could say. When I was 25, I had my first hair transplant with a surgeon based here in Ireland. And at the time, it was in 2006. At the time, there was very little kind of knowledge about it, particularly in Ireland for me, that I looked at this guy. There was 2 clinics in Ireland at the time that were doing it, and this guy was based in Cork.
Okay.
Went to him, and he advertised himself that he also had hair transplant procedure. So, and his looked really good, and I kind of said, well, if his looks like, he was 50, I think, at the time, if his looks this good, mine could be the same. Now, at the time, I'd say when I was 25, I was thinning. Right. I wasn't like I am now. But as it turned out, anyway, I had a procedure with this guy in 2006, 2007, 2008 and a fourth one in 2010. And to be honest with you, the results I got were below average. But the worst part about it was the donor area at the back of my scalp. It was an FUT procedure. Now, I'll be honest with you, I can't even remember how many grafts we got. Like it was 14 years, between 10 and 14 years ago. But the one thing I do know is that I was so focused in that period of time about the recipient area, how good the density was coming on, how, was it going to improve. And like, I go for my first procedure. He says, okay, yeah, what we'll do next is we'll thicken it out with another procedure and maybe give it a year. And the worst part about it was what he left my donor area like. I have 4 scars, FUT scars.
And you have four. You have four separate scars, like a stepladder.
4 separate scars. Yeah,
oh,
4 separate
Jesus.
scars.
I'm so sorry to hear that. Man.
The best way to describe it would be is like the 2 upper scars would be like how could I say? It's like a smiley face. Like you have the top scar. And the second scar down would meet at the end, so you'd have like a smiley face, and it was the same on the third and fourth scar down. So I have these 2 smiley faces on the back of my head, and it was. I never knew how bad the donor area was until I was getting married in 2012, and I wanted to get my hair cut. I kind of always had a bit of length in my hair, and I wanted to get my hair cut short. And the barber said to me, "You've got bad transplant scars in the back of your head. You can't." Anything shorter than an inch and a half on the back of your head, your scars are going to be quite visible.
Right.
So about 6 months after that, I went to a plastic surgeon in Dublin, and he did like a scar revision where he did manage to kind of, these scars you're talking, they're at least, I would say, 5 to 6 centimeters or millimeters wide each one.
Jesus, I'm sorry. I'm sorry. I mean, as you're speaking to me, I'm trying to picture what and why this guy did what he did.
Yeah, and the interesting thing about it was, at the time, I was kind of duped into, like, rewind the clock back 14 years in Ireland, the subject of hair transplant surgery here was very much taboo. Not very many people knew about it. If people did get hair restoration procedure, they didn't talk about it. They weren't open about it like they are today. And I don't know.
Can I just ask you, what was this doctor's first name, initial M?
No.
Okay.
No, but I know that's the other doctor based in Dublin.
Okay. No,
I can tell you the doctor's name because he seems to have disappeared. I've heard different rumours about him. That one I heard is that he's passed away. Another I heard is that his clinic is gone now. I've heard that he's passed away. But the thing that got me about him, his initials are CK.
Okay.
The thing that got me about him was that he kept kind of promising, like I was saying, my scars are a bit, and he's, you can come back and we'll fix them and we'll do a scar revision on that. And eventually he disappeared. I heard he wasn't well. Then I heard that he passed away, but then I heard that he moved to the UK. And then I looked at an online forum, and I think there was civil action being taken against him. And but since then, I kind of accepted. Look, I met Spencer Stevenson Specs about 4 years ago.
Oh, okay, good.
I went over to meet him in London, and I remember telling Spencer about this particular doctor. And when I mentioned the doctor's name, Spencer said to me, "I think he's been struck off. I think he lost his medical license for practicing."
Yeah.
And at the time, I actually met Dr. Scott Alexander from Phoenix in London for a consultation, just to see. Like, the one thing I was worried about was, like, I'm realistic when it comes to like my hair at the minute. I joke about it with other people that I know that I'd be in the same boat as you. They were telling me that you paint the back of your scalp.
I do. I call it paint. I use something called Dermatch. It's like a compact makeup that essentially just disguises or camouflages the contrast between your scalp and the hair that you have.
What I've been using, and I think what was a saving grace for me, was Topic.
Yeah.
Hair fibers.
It's great stuff.
Feeders. And I started using them, I'd say maybe about 10 years ago. And as soon as I used them, I was so impressed with the results I was getting. Because, like, the results from my procedures that I got between 10 and 14 years ago, they were never They were never, the density wasn't great, and I didn't know any better at the time. I didn't know. I was kind of accepting, thinking, do you know what? Oh, maybe this is the best I can expect, and I just have to live with it. And
Well,
try and,
I can tell you, I don't mean to cut you off because this is an important story, but I can tell you that, back in 2006, we were at a point in hair transplant surgery throughout the world, for the most part, where there were a larger group of physicians who were doing state-of-the-art procedures. However, the UK and Ireland were it was like the dark ages. And there was only...
It's like the trophy of today.
Well, I mean, I would say that you probably get better results, but there's a lot of really good... Well, there's a good number of really good Turkish clinics. So, but yeah, I mean, it wasn't even like the Wild West. There were a handful of surgeons, and they were, in my view, even though they were part of this bigger organization, I'm not even going to mention it, it was constant, in my view, butchery. And every patient that came out of Ireland, I can't pronounce it, or I can't say that well for some reason, my mind is going crazy today, or the UK, had really, I would say, disastrous results. Now, the fact that you said that yours were not great, but you had a really bad donor, I mean, that's pretty common. But the fact that you said you had some growth and you were able to kind of wear a topic, you're actually at an advantage compared to a lot of guys who were getting surgery back then because their lives were destroyed.
Yeah. Well, the interesting thing about it is, particularly, I started using topic. I know, as well as that, I'll mention I've been on minoxidil since I started losing my hair since I was 19. And I've been on finasteride for, I'd say, between 10 and 15 years. Now, the issue is, as well, in Ireland, you would find that a lot of doctors, GPs in particular, they wouldn't be as well informed, I would imagine.
And they don't want to prescribe it.
As physicians in the US.
Yeah.
They're kind of slow to prescribe, and it says, "What's this?" Because it was actually the doctor that did my procedure first introduced me. Also, well, this is Proscar. He says it's the same as Propecia, but you take a quarter tablet daily, and he prescribed me while I was getting my procedures with him. But when he vanished, I ended up going to my GP. And my GP, he gave it to me for the first couple of times, but he was really reserved. He was kind of, I don't know enough about this, and I don't feel comfortable. I'm going to, and he was very, and I'd say there was a period there for maybe a year and a half where I wasn't taking it because my GP isn't going to give me a prescription for this. What will I do? So I ended up going back to him eventually, and he referred me on to a dermatologist, really nice fella based in Dublin. And I go to him every 2 years now, and he gives me my 6-month supply, and that lasts me 2 years. And I'm actually going to see him next week because I'm on my last.
So let's get to your story about Alexander. So you went to see Alexander. You had a consult with Alexander, and what did he say?
And the concern I had, even from meeting with specs, was my donor area. Is there anything that can be done? Because since I started using Topic, say 10 years ago, great coverage. But I just noticed as time went on, I was going through more fibres than I should be.
Yeah.
That first, a month supply would last me a month. But now I'm at the stage where a 5-month supply would last me a month. And it's kind of at that stage that, I would be, if I was to send on pictures to you, you'd look at me and you'd see, the transplanted grafts that I have on my hair is very thin.
Okay.
They're very thin.
How old are you now? Did you tell me how old you were?
I'm 39. I'm 39. I'm going to be 40 towards the end of the year. Yeah.
Okay, so you're married and you're
married, 2 kids. Yeah.
Okay, so your life besides this. Yeah, go ahead.
Sorry. Yeah, I know people have had their issues with I know the side effects of finasteride. I'll be honest with you. I have 2 kids and I've been fine. It affects people differently.
Absolutely.
But I've just noticed, particularly in the last maybe 3 to 4 years, and I think that's what kind of spurred me on to go and meet specs, was that in particular when I put the topic in my upper mid scalp to the sides, there was the donor or the density is very thin there,
right?
And it nearly looked like a fuzz in among the hair.
Mm-hmm.
It's like it was covering the scalp, but it was like a fuzz, and I was kind of thinking, my front, the density isn't great, but with a bit of topic in it, it looks fine. But as you go further back into the scalp, it kind of, towards the crown, from the mid scalp towards the crown, it kind of looks, if people were looking down the top of your head, they're going, "Geez, that doesn't look
Right.
a bit strange."
Well, so what is your goal right now? I mean, where do you want to go from here?
Well, right now, I have after meeting specs and listening to your podcast, I've done my due diligence. I did an online consultation with Dr. Pradeep a couple of months back.
Okay.
And I researched the hell out of all my different options, different, doctors that are on your IAHRS.
Right.
That's on Joe's list on his website.
Yeah.
And particularly ones for, like people would say, "Oh, you're traveling to India. It would cost me the same to travel to India as it would for me to travel to the US."
Right.
And I did an online consult with Dr.
Lupinzula.
Lupinzula.
Yeah.
I did an online consult with him, but I've been on the phone to video calls to Pradeep twice, and I have such a good feeling about it. And he has looked at me and he's looked at my case, and I'm going over to him on the 24th of August.
Well, listen, I will say this, that you found, if you're going to travel to India to have a hair transplant, you found the clinic. There are maybe 3 or 4 clinics, maybe 5 clinics, and surgeons. Well, now maybe 6 surgeons who really know what they're doing and produce consistently high quality, state of the art results, and also places where you're going to be safe, in my opinion. Absolutely, you picked a great clinic, and I think Dr. Sethi is he's a really kind guy. He really cares about what he's doing, and I don't know. You explain what your situation was. I don't know exactly what he can do for you. Tell me what he said he can do.
Yeah, so the good thing is that he looked at my case and I showed him and I was worried about the donor scars. And when I met Dr. Alexander 4 years ago, he was talking about the possibility that he might be able to get a further 1,000 grafts from an FUT, and I think the idea of more scarring with FUT, it scared me a bit because I've had such a poor experience in the past with it. And then I met with I did an online consultation with Dr. Pradeep, and I sent him on my pictures, and he just said, "Yeah, you've actually got, your sides are untouched, so you've got some in the bank." So he is, the great thing about it is that he has put me in touch with 2 other Irish fellas that travelled to him last year and got procedures done with them, and I'm in touch with them through WhatsApp. I've met one of them for a coffee, and they are over the moon with their results. And it's just having that support network there that like when I got my procedures done 14 years ago, I didn't know him. I didn't know anybody that went to this doctor that I got my procedures done with back then. I didn't know what he was like. The thing that I felt I was fooled into believing, or being naive about it, was you think when you meet a doctor that, well, a doctor is a reputable person. They're not going to do you any wrong. It's a high-standing job for people to have, and they've went and got their qualifications, and they're honest people. And it was that naivety that kind of led me to. And this guy as well, I think he had some award from the ISHRS.
Oh, sure. Listen,
I was kind of
I'm going to say something.
You guys exactly like.
Yeah, there's no standards, in my view, when it comes to any organization that has been in this field, except for, what we created 20 years ago with the IHRS and what Joe's doing and what Spencer Stevenson is doing. There are no other standards, and that's in my view, and that's a sad part of this field. Even with what we're doing, people are getting fucked up. It's just the way that it is. Yeah. If anybody, even in the best hands, could have problems. This is cosmetic surgery. But at the very least, what we're trying to do is provide a safer place for people to start to do their research and understand that they need to do their due diligence. Anyone who says that they're award-winning and all this, it's all bullshit. What awards can these guys actually win? There's no real awards out there.
They pay for them.
Well, it's
like,
just
back then I was so fooled into believing that this guy was so good. I just, well, he's got an award from it. Like, he must be good. And
look,
I just,
if someone does their
now
time,
I know what I didn't know back then. You know,
if someone, it's not a meritocracy. You know, if someone does their time in these bureaucratic organizations, they will get awards. If they do enough time, if they volunteer enough of their time to be on committees and all this happy horse shit, they get awards. They're not getting awards for true, in my view, contributions to this field. Every once in a while, there is an award given out for someone who's really provided a significant contribution to this field. But usually it's just kind of like, you know, okay, it's time to give this guy an award. He's been around long enough.
Yeah.
So,
And there's like, they've not done anything as such, But no, like, I'll be honest with you, I feel I'm really excited. Like, even the two guys that were over in eugenics last year, they're coming back to me saying, we're actually so excited for you because you're going to have a good experience. And I've researched the hell out of it. I really have. And I just feel so good about going over. I'm actually looking forward to going over. Like, I've done, like yourself, I've done everything. I've done where you're buying the online potions that didn't work. I tried shaving my head, which I hated. I just hated myself with the shaved head. And I know I'm going to have to get my head shaved when I go over, but, like, you know, it will grow back.
Sure.
But, it's just like I have been up and down the road of trying different things, and it's just having, you know, finding guys like yourself, Joe, and Specs is just, it's so good that there's honest people out there that are steering us in the right direction. That you're saying, well, look, this is a fucked up industry, and, you know, but there are decent people. It's like in every walk of life, you're going to have, you don't want to tar everybody in the set with the same brush. That you're always going to have bad eggs in every field, you know.
That's right, and that's why, you know, what we've been trying to do, what I've been doing for doing this too long, almost 23 years, is just trying to provide people with a chance, just a fucking chance to do okay in this field and to have a good outcome. That's the best that we can do. And I'm sorry that you went through what you went through, but your story is a cautionary tale for everyone who's listening, especially the young guys who believe, well, that's an old story. That happened 14 years ago. It's still happening today, and even worse.
I had four, like, even from talking to you, listening to your show, Spencer, I know that, like, from listening, like, even now I know I had 4 procedures done before I was 30.
Yeah.
And, like, I was way too young. I didn't know any better at the time. Like, I went to this doctor, and am I too young to get this? Oh, no, you'll be fine. No, we can do this for you. And we can do that for you. And I felt I trusted him. But looking back now, it's only in those, like, people say, well, why did you keep going back to him for 4 times? Because I was so focused on, he was saying, oh, we can do this and we can improve it and come back again and we can improve it. And it was only 2 years after I got my last procedure with him, when I went to get my hair cut, and my barber said to me, you've got bad scarring in the back of your head. And then my focus shifted to the donor area, and holy shit,
and
that is really bad.
Here's the reality, is that you know, we're all vulnerable. You were vulnerable, especially because you were younger. And that type of vulnerability is the bread and butter of this industry.
Yeah.
That's reality, and people have to know that. And I guess what I've been bothered this last week and a half, or not really bothered, but what's actually put some more fire under my ass to continue to do what I do, not retire and just keep moving forward, is, you know, we're starting this organization, we're starting this, we're basically putting together this online conference where physicians really have the opportunity to get an education on the reality of this, what I consider to be an incredibly elegant and difficult form of cosmetic surgery, where they'll know, you know, about lives like yours, who, you know, people who've suffered over the years at the hands of people who weren't really trained to do this well. And this organization that you said this doctor received an award from is actively trying to stop us from doing what we're doing, which is insane. So to me, that speaks to the reality of what this industry is. And you found somebody really good. I think you're going to be in good hands. Again, you know what the possible pitfalls are, and you also know what the upside can be. You found a great surgeon and a great clinic, and I'm glad that you found us. And I only wish that you would have found us in 2006, because I've been doing the show since 1998.
Yeah. It's just, when you look back, and it's just kind of, like, even back then, the internet was kind of, new in Ireland.
Yeah.
Well, it wasn't new. It was still around, but it wasn't as common. Like, it's in every household now. But
I know.
back then, it wasn't everywhere.
I know.
I used to have to call up to my mother's house to use the internet.
Yeah.
And it's then, and it was actually, I was in work one day and a guy was saying, did you ever hear about a hair transplant? This is what they do. And then I looked online and said, oh, well, there's this guy based in Dublin and there's this guy based in Cork, which is in the south of Ireland. And it was the guy in Cork I went to, and he sold it, goes, oh, look, I've had a procedure, look at what I've, and I kind of said, well, geez, his looks really good. But he didn't do it himself. He obviously got some really good surgeon.
Absolutely. He went to somebody here in the U.S.
Yeah, and advertised that, look, I can do the same for you, what I've got here. When it was a far more skilled doctor did his work.
100%. Well, listen, man, I really appreciate your call. We're going to take another caller, but you let us know. I want you to follow up. Let us know how you do with Dr. Sethi.
I was just going to suggest to you that, after I come back from India, I'd love to give you and Joe a shout back just to let you know what my experience was like, just to see.
100%. We'd love to hear. We'd love to hear from you. And listen, I'm glad that he believes that he can help you, and I'm glad you sound like you have. You've had a relatively typical experience, sadly, in this field, but I'm glad that you've been able to move on with your life and that you're able to get married and have a life. And, you understand now maybe the possibilities of what can happen in your future. If you have enough donor, there's a good chance that you can be repaired to the point where you feel even more comfortable.
Yeah, exactly.
All right, man.
Thanks so much for taking the call, Spencer.
You got it. I wish you the best of luck.
I'll chat to you in a couple of months.
Okay, good luck.
Yeah, brilliant. Thank you.
Bye-bye.
Take care. Bye-bye. Bye-bye.
888-659-3727. Joe's still busy, but let's take this call. Hey, you're on the air. Who's this and where are you calling from?
Hey, Spencer, it's Bruce. How you doing?
Bruce, where are you calling from?
Yeah. Sorry about that. Hey,
where are you calling from, man?
Can you hear? Bruce, Houston.
Houston, how are you, man?
Yeah, I'm doing great, man. I call in from time to time.
Yeah,
so,
I recognize your voice. Sure.
Yeah. So where's your sidekick? Is he over there doing something?
Apparently he's taking some really important phone calls, which is more important than the broadcast tonight.
Hey, man, there might be money involved. You never know. So, I had sent him an email. You remember on the last show, he talked about the consultation, said if he ever did them, it'd be too expensive, not worth your time.
Yeah.
And then y'all were ending the show, and I said, I thought to myself, I said, hey, $500 would be a good price. And then that's what he said. Oh, it'll be expensive, $500. So I anteed it up on email. Said, I'll give you $1,000, man, and fly and buy you dinner just for your advice and wisdom and experience.
You know what? I will say this, that it would be of tremendous value to any patient to make that happen. But, Joe's not going to do that. And frankly, and I've been asked over the years, since the beginning of my career to do that. And I'm talking like 1998, I've had guys offering me $500 just to sit down with me.
Oh, wow. Back in the day.
Yeah. And I just be like, listen, I'll give you a call, whatever. I'll do the best that I can to help you out.
Well, it's also people that have older guys like me that have had some stuff done in the past that to get repaired and stuff, and but not extreme, just something that might not bother you.
So why don't you remind me of your story? What happened with you?
It was 1995. This is probably a little bit before you guys started. It was at Bosley. You remember how I'd gone up to back then. Of course. Well, Houston, they didn't have too many people doing it, and then they had a clinic here, but they didn't have they had a consultation office, but not a clinic. The clinic was in Highland Park Village up there in Dallas. And so I flew up there, and but they didn't. They cut low and then high, and they said they did low because of the finer hair, which we know that's not true now. That was how they sold it back then, and they did for some reason they did small sessions like maybe 500 grafts or something like back then.
Well, that's all they were. They didn't have the infrastructure back then. They didn't understand, and they weren't doing follicular unit grafting. They weren't using microscopes. They were dissecting it, cut the size, mini and micrographs, all under. In some cases, the technicians weren't even wearing loupes in these places. They were doing it just with the naked eye. So back in 1995, that's around the time that I was really researching for myself and also for my book. I already had in my mind that I wanted to write a book about my experiences. And I can tell you that it wasn't until 1990, end of 1996, that I found a physician who actually was able to show me a reasonable result. And that's when I decided to write about follicular unit transplantation. And at the time, there were only 11 physicians in the world who were doing it. And sadly, Bosley was not one of those groups.
Well, but man, they were just, you know how it is. I mean, it's the one who gets their name out there and the advertisement, and that. I mean, they still advertise on satellite radio, and every time I hear it, it just disgusts me because I'm thinking, man, some poor guy's going down the road listening to that. And
I want to be clear, though. I mean, they have come a long way, and they are now, in general, for the most part. I'm not saying that everybody that sits in a chair for one of Bosley's doctors should be having surgery. I'm not saying that they are providing what I would consider to be, a really completely 100% reasonable education to patients, because you have to understand, they're spending a lot of money for leads and they want to sell that surgery, in my view. However, in general, I think overall they've come a long way. The procedures that they're performing are generally much better, and they are performing state-of-the-art hair transplant surgery. However, it's still an organization that's selling a product.
Well, yeah, and they fast forwarded 25 years from when I was there. So, I mean, and that might be fine for somebody else that goes there and gets good results. I mean, I'll never go back personally just because it's an issue that I have. So, I mean, but it's nothing, doesn't mean that, like you said, they don't produce good work nowadays. So.
Well, I personally think you have to be out of your mind to go to any type of a chain clinic to have surgery. I mean, if you think about that, I mean, back in the day, I understand, but if you really think about that, I mean, and I understand the mentality when you hear that there's a name out there that's been so long and that this company's been doing this for so many years, or, that's all we do, and our doctors, we only focus on hair and we have all these different options. That sounds great. But if anyone would take the time to do any due diligence, they would recognize that you never want to go to any place that's has to spend the money that they have to spend to get those people in the door.
Yeah.
It's a business.
And that's so true. Yeah, it's so true. But like you said, back in the day, you didn't have IHRS. You didn't have, those things. And it was turning the corner like late 90s, early 2000s, when it started, and unfortunately, it was after the fact. So when I went, like guys that went in the 80s or early 90s up until 95 or late 90s, it was just that's just how it was back then.
You know what? And it's bad now. It's still really bad. And that's why Joe and I and, some other people who are involved are really trying to push the envelope this year, because as good as things got in the mid 2000s, things have reverted back to, in my view, being even worse than when you had a hair transplant. So your current situation is, you said you wanted to have a consult to kind of pick Joe's brain, or, I mean, where are you at this point as far as your research?
Well, that's the thing. And when I say consult, I'm not there to ask, of course, I understand his position, and there's no way I would ask him, hey, refer me to a doctor. There's no way, because I've got a list of guys y'all talk about all the time that I'm going to go get, consultation with. All I wanted to know was, hey, I got this list of questions. What else can I add to this? What can I tweak? What can I do? What is there something important I'm missing here? That kind of stuff.
Well, let me ask, if I can answer any of your questions right now, I will. Joe's obviously he's busy.
Well,
but
my typed list is over 20 questions, but it's at work. I can't remember them all, but I can tell you a few of them.
Yeah,
a few of them are like just the frontal 2 inches of the hairline is still got the plugs there where you can see, but with the but it's still I still have a lot of hair that it's not, with gel or cream, whatever, it looks fine. I can wear it semi-short, that kind of thing, but I wanted to soften that up. I wanted to get that softened up, and I also wanted to, add some, some density, of course.
Now, now, as far as your consults are concerned, what if physicians told you that what was their suggestion and assessment?
No, I haven't got. No, the list that I have, there's only 2 here in Texas that I had on the list, and the rest are out of state. So I haven't, made the trip. I wanted to go in person. I didn't want to do it because see, in person, what I'm talking about, they have to see it. They can't look at me on a FaceTime or WhatsApp.
100%.
They have to actually see what I'm talking about. Yeah.
Now there's a couple of things that they would suggest, and it really depends on your particular case. But if you're saying that you are able to kind of get away with it at this point, and you're relatively comfortable, and you just want to soften things up, a lot of physicians will say that they'll try to work around the plugs or work around the mini grafts and soften it with, finer, one, and then obviously going further back in your hairline, 2 hair grafts, not removing those mini grafts, and then, potentially leaving even more scarring. Now, if you have a lot of cobblestoning, which I don't know if you have, and you have kind of scar tissue that is, or tissue that's relatively fibrotic in between grafts, it's possible that some might suggest that you remove those plugs or remove those grafts and then cut them up under a microscope into smaller grafts or into pure follicular units and then redistribute that. That's more of a pain in the ass, and that's going to be a bigger procedure for you, and there's going to be more downtime for you as well. But that's really the two options that they're going to offer you.
Okay. Yeah, okay. I see what you're saying because, I've heard other doctors say, we'll just plant more bushes around the shrubs around the oak trees. And I'm thinking, I don't know about that, and then because, the only one I know of like Cooley, how I've watched so much of his stuff where he can actually, extract and.
Yeah, and they can. They could extract those grafts, and it's really possible, depending on how they were grafted to begin with, that you will be left with very little fibrotic tissue, and he can then dissect those grafts, reuse that hair, dissect them under a microscope, and reimplant them in a more favorable way using smamer, singles and doubles.
Mm-hmm. I have enough hair behind it to where it still looks fairly thick. So I mean, I'm talking 3 to 5 on the high side that is kind of visible. The rest of them, the other maybe 3 or 4 would be behind the little bit further back. So like if I had some more single hair grafts in front of them, they wouldn't. You'd never know.
Well, if you're only talking about a total of 10 grafts, then I would say that they would probably suggest that they remove the grafts.
Okay.
So you just said 3 or 5 grafts,
and then the single hairs need. Well, how does that work, Spencer? If they remove those, and then it's in the area where the single hairs have to go, do you have to heal up and go back a second time, or can they do it then?
Well, there's 2 things. They would initially close up, or try to close up that area, or close it up, suture it, and then they would graft around that area at that time of the removal, and then you might have to go back in, depending on how you heal, to have some more grafts placed around it, or even within the scar tissue. That's a possibility.
Okay.
The easiest way, obviously, is if the grafts aren't, really that distinct, and you believe and a physician believes they can be camouflaged, that's obviously going to be the easiest way for you to go, without the possibility of, even though it's unusual, anytime you cut a hole into your scalp, you could have complications. You could have. Go ahead.
No, so. I think that, like you said, that option there of adding to it for the density to camouflage or to blend in, I really would like to go that option if possible, because I guess I'll have to see him in person, and that's why I was going to ask you or Joe. I think that actually they could put some just in front of it. I think the hairline, I don't know, I could be wrong, but I think it's up high enough to where it wouldn't be too low. Does that make sense? I think
it does make
just
sense.
In front of it a little bit.
It does make sense, and it's very possible that you do have that space.
Then again, I might. Yeah.
Right. And guess who's back?
Cooley or huh? Oh, Joe.
Guess who's back? And maybe you want to ask Joe, because he's obviously been too busy for your call.
Yeah.
He's putting his headset on. Oh, guess who's back?
Yeah. Big Joe.
Too bad your mic is off, Joe.
There we go. How's that? Better?
Yeah.
Yeah. Sorry, I had this. I've been waiting all week for the fucking internet company to finally get back to me for a solution to this problem I've been having. The worst, I've never had a customer service nightmare like this in my life, and I had to take the call. So apologies. Anyway,
Well,
where are we? Who's this?
Where
am
any,
I?
This is Bruce in Houston.
Hey, Bruce.
So
how you doing?
maybe you could. I'm doing great. Maybe you could have some options and tell them you just switch internet companies if you had to. You know,
that's what I've been trying to do. It's a whole it's a whole huge mess. It's just.
Well,
like
I've been on the phone for a few minutes. Oh yeah. Oh no. I've been on the phone a few minutes now with Spencer, but just in a nutshell, what I was asking him. Well, first I brought up the consultation stuff. I emailed John. I said, hey, on the last show, I said I'll give Joe $1,000 and buy him dinner, or something. But then Spencer said, hey, give me your questions. So he helped me out with that.
Well, one thing I would say is that there are people out there who are on the internet, young guys who are actually providing these paid consultation services. So they, what's interesting is they are available, but it's something that I'm just not interested in doing, and I don't think Joe is either.
Well, funny enough, I actually just had a guy email me saying that he would fly here to Vancouver and pay me $1,000 for an hour of my time.
That's the guy you're talking to.
That's who you're talking to.
Was it you?
Yeah. Yeah.
Oh, it was you. Okay.
And I asked you, and I typed you a question about an hour ago. Hey, Joe, are you going through those emails and responding? But I know you're busy. You can't read all those threads on that. But
I actually just read it today. Yeah.
But you know what, those, and I told Spencer, it wasn't to find out who to go to, because I already know who to go to. It's not that at all.
Yeah.
It's about, hey, all these 20 questions I got, is there something I'm missing here that's important, that kind of thing. That's all it was. But I get it. I can go over there with my list of questions. I can go to Cooley or Rocha, whoever, and, and find out, just what they say. If I go to like 3 or 4 different people.
Well, remind me, you've been through how many procedures already?
Okay, in '95, I did Bosley. I did 2 different ones, but they were small. Like I told Spencer, they were back then. It was like 250 to 500 grafts that they said they would do. That was 1995. So, fast forward, I went down to South Florida before I even knew about you guys, and so I've had the FUT only. So remember when Bosley did it, they cut me up high and low. And remember when I said low, they did it because they said they wanted the finer hairs, but they messed up because on the right side, I got to let the hair grow out a little bit longer because I'm sure you've seen that on people before to where, it'll ride up a little bit because I guess they didn't know then to go into that sweet zone. And then of course I got one through the middle. So my question, I'd have to see a doctor in person, not on FaceTime or a consultant to say, hey, yeah, you do have enough donor hair for FUE this last time. You do have, because the sides are pretty much virgin as far as donor, and I've got thick curly hair, but my hair is white now. And so, but I got that 2-inch area right in the front. I was telling Spencer, I've got like, 2, maybe 3 to 4 to 5 at the most that really bother me every morning because that's the first place you look when you get out of the shower and you brush your hair. You look right there and you see that. But when I put the gel and the cream in it and the hair's curly, it's fine, but.
Oh, sorry. Back up. What is it that bothers you? What specific thing?
From 1995 when Bosley did back then they didn't know how to do single hair grafts, whatever. So I guess there was just some different plugs right there in the front. But I have enough hair around it to where it's semi camouflage, but I can see it. And if you or Spencer walked up to me, I'd have to pull my hair back if y'all did because I'd have some gel or cream in it by then. But if it's just dry natural, I can pull it back with my pinky, just straight back, and you could see it. But it's enough to bother me to where sometimes, hey, I'll get out. I just want to comb my hair straight back, and every once in a while, you want that look,
No, excuse me. I totally get it. I mean, I'm the one that had, I had one multi-hair graft in my hairline from, I don't remember when it was placed, but in my last procedure, I asked,
Dr. Wong. I remember I watched your video where you asked Dr. Wong to remove it. Yeah.
Yeah, just take out because it was just bugging the shit out of me. I totally get it, man. Yeah. It's like if you're in a position where you can have that done, nothing wrong with it whatsoever. But in your case, it's like you got these plugs. Like how many plugs is it up front that's bugging you?
3 to 5. because there's two there's two. Sometimes there's enough like hair around it to where I got to go real close and look. But there's 2 or 3 right there in the front that really bother me.
Yeah.
I mean, it's right dead center. But I think my hairline might be up far enough to plant to go with a few single hair grafts in front or around it to camouflage. I don't know, and that's what
I think it might not be a case of camouflage as it is so much of reducing the bulk. A doctor could go in potentially, I'm speaking sight unseen, could potentially go into those plugs with a small punch and remove a few of those individual grafts or follicles, because they are grafts inside. Like a plug has multiple grafts inside of it, or follicles. Sorry, FUs. You could go in and have a few of those thinned out, and that could be the answer to your problem right there.
Oh wow!
Just thinning it out.
And you talking about just thinning it out with no additional density?
Yeah.
Is that what you're saying, or just thin? Okay. Well. Yeah. I would also
like
to have
if it's a small thing. Well, who doesn't? Like, I get that, but the ultimate question is, what is your ultimate goal? Like, what's your final goal on this? Like, just to, like, it's bugging you, it just kind of stands out because it's this pluggy looking area, or you want it to be a thick mane of beautiful hair, or you just want it to look natural, which isn't always synonymous with the other things I talked about.
With natural, yeah, because at my age, you're not going to have a mane or anything like that. But it's enough, like, so that's about it. I mean, if you saw him, you'd go, well, yeah, I'll just do that. I'll go to, I know Cooley's real good at that, so I'm going to try to get something going with him.
Yeah, I mean, there are several doctors that are quite good at that, but I just saved you $1,000, man.
Yeah. Well, hey, but hey, Joe,
I appreciate that. I really do appreciate that. But it's really simple. Like, go for the least invasive. And when I say invasive, I don't mean like just surgical. I mean, downtime, cost, all this. The least invasive to your lifestyle and your life in general approach to get where you want to be. That makes sense. You don't. Yeah. And I'll tell you one thing. What you're asking for. It's really easy to say, okay, I want to get this done, and let's assume you go in and tell Dr. whomever, yeah, I just want to have these thinned out or just make them look more natural, and just say the doctor says, yeah, well, we can take a few of those follicular units out of those grafts to thin it up, and that'll help with the appearance. It's really easy to get sucked into, okay, but can you put just a few more here? Can you put just a few more over here? When all you have left is a few more, and you wind up tapping yourself out, or maybe even overextending yourself as far as what you can do, and then you find yourself in the same situation or maybe even a worse situation. So the message here is, don't get greedy. Like, if you're happy with the overall appearance and it's just that one little thing bugging you, do what it takes on the low end to take care of that issue and call it quits, man. Because every time you step up to bat,
that's great
another
advice,
time
Joe.
The ball can hit you in the head.
That's great advice. And
I know that, and that's the thing.
Go ahead, Bruce.
No, go ahead. I'm sorry.
You go ahead.
That's the big deal. Is I'm at the age and through my life that I want to be the least invasive. I want to have that natural look. So you can't. But you just can't go. I just know at my age through wisdom myself that you just can't go to anybody. You got to go. Like. I know there's a few guys here in Texas, but I hear you talk about Rocha. I don't hear y'all talk about McGrath anymore. I mean, he's still on the list, but I mean, I don't know anything about him really. But the other ones are going to be out of state that I'm going to have to go see. And
here's the thing. I mean, what you need to do is you need to get an assessment from. You can get assessment from the guys who are close to you, and you can get assessments and a consultation, at least initial consultation. I know you want to see somebody in person. But with people who are out of state, just to get an idea of what they're saying to you. You're going to be able to make sense out of it all once if everything's very consistent, then you're going down the right track. If there are guys out there who want to be more aggressive than others, that's probably not the direction you want to go into, even if they're IHS members.
Yeah.
Yeah. Well, and that's hey, real quick, y'all, huh?
Yeah, go ahead.
Because my wife, it's funny because, I'm going to retire in 2 years, and she's and she knows this really bothers me. I don't want to do it. So like when I tell her I'm going to do this thing right when I retire, I got to do this, whatever. And she's just rolling her eyes, going, "Okay, here we go again." You know what I mean?
Sure.
But it's just one of those deals. So I want to make it a one-time deal and get out, because I can't be going back.
Well, I think Joe's advice is really good. If you would be happy with just kind of like, removing some of those grafts, making it easy, not necessarily implanting around the grafts. Like I told you at the beginning of the conversation, you're going to be given two options, and option A and option B. But Joe's option is actually good. Maybe just thinning out the herd, so to speak, removing some of the unnatural grafts and just moving on, if you will be able to maintain a look that you're comfortable with.
I got you. Okay. Hey, I know I've been on here a while now, but one other thing I wanted to ask y'all. So since the, this COVID thing's killing people as far as like, economy, businesses go, and, like here in Texas, it's really bad right now. It's flared up, so you can't go anywhere without a mask. But, the sports bars and everything, they're in Austin, Texas. They've been protesting Greg Abbott, our governor, and they've been, people are losing their jobs again. It's just crazy, out of control. So I guess what I want to ask in the hair industry, even all these established, well-known, I guess, successful, cream of the crop doctors that y'all know, I mean, is it only the strong surviving, or, I mean, are these guys now going to cut corners on some ethics, or, what are we facing?
Honestly, I'm going to be honest with you. Right now, it is the strong surviving. The guys that, at least the guys that are contacting me about it, if they were, most of them were shut down, obviously, and there were people just waiting in the wings to get surgery. So these guys who are really well established, who have a really strong presence, and who are well known part of what we're doing, most of these guys are going to survive. A lot of the guys who were initially cutting corners and who were turnkey guys, they may not survive. But what's going to happen is there's going to be a whole new crop of turnkey, one-size-fits-all clinics coming up. So as far as the list that you have, can I guarantee that people aren't going to cut corners or maybe bring people in to have surgery that they may have considered not being a great candidate before? I can't make you any promises. I mean, that's human nature. You still have to do your due diligence. And I would say that more than ever, maybe you have to do even more research now. Yeah. You have to be 100% confident. Listen, you found us, you found Joe, and you understand what you're getting into. And you've probably already picked, you said, you've picked the physicians who you're considering seeing. All of those guys are going to they're going to be in business. So you don't have to worry about that.
Man, Spencer, you and I, we've seen guys from way back in the day where the back of their head looks like Swiss cheese from the 1980s all the way up to the doctors now that do quality work, and like that doctor over in Bulgaria now doing these mega sessions, and it's unbelievable his results. I don't know how he gets that density, how he does it, but you know who I'm talking about?
I do.
Bulgaria?
Dr. Zarev. And
Zarev, yeah.
He is, listen, he's a young guy. He's really skilled at what he does, but you also have to understand, and there's nothing against him, it's all about the candidate as well. Those candidates are chosen to highlight what he's able to do. That's just the way that it is. If you're not a candidate to have that much hair moved, it's just not going to happen. Can't do it. He's not going to push the envelope and potentially harm somebody. But that is his strong suit right now, so that's what's being promoted. Would you agree, Joe?
Okay.
I would. I would. And look, anyone that thinks about the donor region can get out that many grafts if they've got a small punch and they understand the idea of spreading out into what some people call the expanded donor or the expanded safe donor. That's all there is to it. I mean, this isn't rocket science, and there's no voodoo that's being performed to do these big sessions. The question is, who's the candidate? Because not everyone's a candidate for something like this. Like, I wouldn't have been a candidate, like Norwood 6.5, whatever, back in 19 or the early 2000s, when I had my my first repair surgery, I wouldn't have been able to be one of these guys that gets 15,000 grafts with FUE and not look like I wasn't plucked like a chicken.
Right.
I just didn't have the donor.
Right.
So,
Right.
and it goes back to patient selection. Like, a good clinic will have a lot of great home run results because they know how to pick the right patients, and they turn a lot of people away. Like, I can't count how many times people have come to me, like before I was even so much like don't have surgery at all, unless you absolutely have to. I was still turning people away left and right because they weren't candidates for what the doctors I was working with.
And the one thing you will notice with these big cases is these guys have huge fucking heads. I'm just kidding. Just kidding.
Hey, but Joe, you know what? I mean, that makes a lot of sense. I mean, because, like I was watching a YouTube video and McGrath he had a young guy come in, kind of a, big guy, but he, I think he was a Norwood 6, and basically McGrath had talked to him and told him how it's not ethically right to even try to do anything on you. And he goes, any doctor that tells you that is going to be doing you an injustice, And so he got him on finasteride and whatever, and I guess some other treatment. And then a year later, he was showing the before and after, saying how now it looked like his donor had grown to maybe to where, he had it was a major increase if it's not, played with on the camera, whatever, it looked like it was a major increase, and he was considering then about doing one. I mean, is that possible that's not me, but I'm asking about, is he shooting straight there, or is that bullshit? I mean,
well, okay, so
I don't.
I'll answer your question with a question. So if someone says to a patient, it's not ethical for anyone to do surgery on you right now, but take finasteride and let's see how you work out, and then the donor region. Let me back up. Are you saying that the patient was that he had a bad-looking donor region as well?
It wasn't bad. It was just, I don't think it was enough. It just didn't look. He looked like, how some people have the hair to where it's not as thick, and like a guy like me that has curly hair and stuff. It was more like a fine hair, maybe.
Mm-hmm.
So, and it was
low density.
It was a full blown. Yeah, and he was full blown, bald eagle on top. So I mean,
okay.
I don't know. Yeah.
Was it full blown bald eagle on top after a year?
Yes, but the donor looked like it raised up to where into the crown a little bit.
Okay,
so
that's what I'm going for. Okay.
It. Yeah.
No. I just want to address the black and white of it. So, so if the donor improved after a year from finasteride, the question is it still unethical, or is it ethical now to perform a surgery knowing that the donor region is so reinforced by medication? What does that tell you? It tells you, or it should tell you, that maybe that donor region shouldn't be touched surgically because of the multiple cases that we see where someone switched their finasteride source. If they're taking generic and they go to Costco and Costco switched it from brand A to brand B, and it's not quite as effective, which we've talked about till we're blue in the face on the show. What happens to the guy's transplant if he's still taking finasteride, but it's just not as effective as the previous version that he was taking? Or what if he just stops taking it altogether for whatever reason? What happens to the transplant? Is that ethical?
Right. Yeah, I got you. I mean, I still don't think he would be a good candidate. You're right.
Now, I also think it's important to note that, that's why it's called the practice of medicine. There are physicians out there who might miraculously believe that, well, all right, they're doing really well on finasteride. There's a good chance this is going to help him for decades or more. So maybe you could make a good candidate. I tend to agree with Joe, and I would say no fucking way. How's that for being blunt?
Well, and then
Bruce, man, we got to move. We got to go.
All right, brother. Yeah.
Listen,
y'all be good, and I'll talk to you next time.
Listen, happy 4th of July. Thank you so much for the call, and we just saved you $1,000.
Yeah, and I'm sitting out here in front of the liquor store. I'm fixing to go in and get some stuff.
Enjoy it, man. Enjoy that.
Enjoy it.
will.
I'll tell you
Thanks,
this, Bruce. I want to personally thank you for that offer. It was very kind of you. Very unnecessary, but very kind. I will say I didn't tell my wife about it because you'd be on the next plane to Vancouver if I did.
Okay, I got you.
All right, Bruce.
Well, maybe one day. You never know, man. Maybe you can meet me over there in North Carolina.
Well, you're welcome to come up anytime anyway.
Oh, thank you. I appreciate that.
Dude, why would you say that? Now
All right,
people are
well,
going to
you
want to
guys-
visit me. All right, Bruce, you take care.
All right, man.
All right,
Okay.
bye-bye.
All right, bye.
Take care.
All right.
Bye-bye.
Kind of tired, and I'm starving. I mean, do you want to take a quick call since you were gone for so long? Or like spend 5 more minutes?
Oh my God, Mr. Passive Aggressive, since you're gone for so long.
That wasn't passive aggressive. That was just aggressive.
That was just fucking aggressive, man. Yeah, let's do it.
All right.
Let's do it.
Hey, man, you're on the air. Who's this and where are you calling from?
Juan from San Diego.
Juan from San Diego. What's happening, man?
Hello, Juan.
Hi. I called in the past, and I want to make it quick because I was listening to the second to last caller that he went to this chain clinic, and I don't want to mention the name because that's not even the point.
You can mention any name you want.
Right,
You can do whatever you want, man.
I've had 2 procedures, one of them 16 years ago, another one 15 years ago. And when I saw the latest work on the crown by Jutro, it kind of got me looking into my own situation because as years proceeded, I started receding more, so I needed some crown work, and I got some successful work. But my point is that before my work, my brother had gone to that chain company to get work in Scottsdale, and I always use him as an example of not good work. But now that I've been watching so many videos on YouTube and doctors talking and all this, I realized that he might have ruined part of his own results because he just didn't want to take any pills for pain or inflammation. And I just saw this video from these two doctors, YouTubers from here in the United States that they were saying that the inflammation can have permanent damage on the success rate of the grafts. And when my brother got his work 17 years ago, I remember sessions used to be a lot smaller, so I think he only sat for like 800 grafts. And I always thought that it wasn't enough, and aesthetically it wasn't that bad, but I thought it wasn't enough. But then it got me wondering if us patients sometimes jeopardize our own results by not doing exactly what the doctor says. So if the doctor gives you a pack of pills and indications to follow after the procedure, you got to stick to them. Don't listen to a YouTuber. Don't listen to you. Don't listen to me. Just go off what the list says, because if anything were to go wrong, you can always say, well, I followed what it said on the sheet. Well, my brother didn't do any of that because he doesn't believe in pills. So I remember that he was swelling really bad. Not that night so much, but the next morning he woke up like he had gotten beat up by Mike Tyson and still didn't want to take pills. So could that have any effect on the grafts? I think so. And I'm just saying this because when we don't get good results, we're always so quick at pointing at doctors, but we don't look at what we did or failed to do.
That's a really interesting perspective, especially coming from a caller and someone, who's had a couple of procedures. It's unusual. And I agree with you 100% that you really have to look at yourself and to make sure. It's so important to follow post-operative instructions.
I've been saying that for years.
Yeah.
And the reason for it, it's actually twofold. Number one, your doctor knows your case. So some dipshit on a forum that goes by an anonymous name, sitting behind a keyboard, doesn't know any better than your doctor. I've seen this hundreds of times. I just had a surgery with Dr. So-and-so. I'm 5 days post-op. I'm having this issue or that issue, or I got a question about this. What should I do about whatever? And you'll have a whole bunch of people responding. Well, you should do this. You should do that. Everyone's turned into a doctor, and it's like, no, don't listen to these dipshits. No,
Dude, the
Call your
bro
clinic.
science in this industry is just fucking ridiculous. And I have to say
It's out
that
of control.
we have a forum, baldtruthtalk.com, and I will tell everyone, stay off the fucking forums. It doesn't do me a service to tell you to stay off the forum. But that is how I feel about it. Now, we provide this service for people, and we try to keep it as safe as possible. But you're still going to have a bunch of know-it-alls. You're still going to get advice, medical advice, which we make it very clear. Obviously, we're not responsible for that advice, but we make it clear that we have no moderators coming on the forum giving any medical advice or guiding you in any type of a direction. That is fucking irresponsible. So
I think so.
Yeah, so I tell everybody, forget about what you see on YouTube. Yeah, it's great. There's some good doctors on, who are YouTubers now that are providing some good, really good information. There's a handful of guys, I would say Joe is one of them. Right, Joe?
Well, handful of guys what?
You're not even listening. Good guys. Good guys out there.
Good guys.
Yeah. But most people, because we want to be part of a community, we don't want to be alone in this, we'll take advice from others because we really believe, because we're vulnerable, that these guys have our best interest in mind. You never know where this anonymous information is coming from. That's the key. So if you've taken the time to spend the money and have actually had surgery and you're under a doctor's care and supervision, why wouldn't you follow their, instructions as opposed to somebody on a message form like Joe just said?
You trust them enough to do your surgery. Why don't you trust them enough to follow their fucking instructions?
Right.
It makes no sense to me, But to answer the other issue, the question, someone saying that or thinking that maybe it's the swell. Okay, yeah. So you're not taking the clinic's pills for swelling and pain and all this. Will that affect the grafts? I've never seen anything or heard anything that would indicate that would be the case. Swelling is swelling. I've seen thousands of cases where there is, Mike Tyson fist in your face swelling, and grafts grew fine. Like I can't imagine. The only thing I would think that could influence graft survival is if the swelling is so bad that it actually reduces the blood flow to a specific area long enough to deprive it of oxygen. But I've never seen cases of necrosis would cause that, but not swelling. Not swelling.
Well, yeah, that was just something. I might have misspoke. Maybe he might have said something about infection, and my brother did not take one pill that was in that package. So whatever those pills were for, he did not take any of them. And maybe the moral of the story is to stick what the doctor says and see where he goes.
Well, yeah, absolutely. Yeah, definitely stick with what the doctor says. I mean, again, you're paying thousands of dollars for a procedure with a clinic that hopefully you've researched and you trust them. So why not trust their advice after the surgery to make sure that you're in the best position possible for a good result? But usually a care package after surgery, a packet of pills will be painkillers for a few days, antibiotics for a few days, maybe some sleeping pills, and that's it. Like there's really not much that you need to take, and it's most of the stuff is something you can get off the counter anyway, except for the antibiotics.
Yep. Well, thanks, guys. That was it.
Yep. Excellent.
All right, man.
Thanks
Well,
for the
listen.
question. It was a great question.
Great question. Thank you for taking the time to call in, and I wish you the best of luck. I know that you've had a few procedures and some bad luck, and some, like you said, you had a decent. Your last result was good. This is a process. It's an unfortunate process for a lot of guys who just don't take the time or who don't understand how much research is involved. So I definitely appreciate your call.
Have a good weekend.
All right, man. You too. Take care. Happy 4th.
Thanks for calling.
Bye-bye. All right, guys. Let's call it a night. Jesus.
I want to answer one question in the chat room. MH just asked, what's more important, the extraction of the grafts or the placement of the grafts? My opinion is extraction of the grafts, because that's the first line of failure, first point of failure, and it's also before the implantation of the grafts, which is just as important because you're also handling the grafts, but because it's secondary, extraction's more important. Make sense?
I have no idea what you're talking about. I was just typing to somebody.
Yeah, I'm used to it, man. I'm used to it.
All right.
So that's it.
All right. We're going to call it a night. I want to wish everybody a very happy and healthy 4th of July here in the United States of America.
Absolutely.
The United States of America.
United.
That's what this is where we live. I think it's important for all of you guys to recognize that. And for everyone else, for our listeners and callers we had a caller from Ireland, which I can never say it properly for some reason. Ireland. Ireland.
Oh, a caller from Ireland.
Yeah.
Nice. Did not know that.
I think his name was Pat, as a matter of fact. Pat, thank you so much for the call, and I wish you the best of luck. That's an inside joke, guys. Inside joke.
Inside joke. Inside joke.
Thanks for everyone for taking the time to call in. It was a very busy show. It's great to be back. We have a lot of good things happening in the industry. Again, there's sadly, there's still a lot of just bullshit and infighting, which I would hope after doing this for over 20 years, people would just stop the bullshit and realize we were out here to help you guys. They should be a part of this. They should want you guys to be fully informed and have all the information that you need to make informed decisions. But that does not seem to be the reality for many physicians and administrators in this field. I don't know why.
Yep.
Because to me, there's a lot more, you can make a lot more money doing good medicine than promoting bad medicine. The websites, thebaldtruth.com, IAHRS.org, American Hair Loss Association is AmericanHairLoss.org. Just lost Joe.
Yep. Audio's here, but my monitor just went out.
Yeah. And Joe's website's hairtransplantmentor.com for everything Joe Tillman. You could also please subscribe to Joe Tillman's YouTube channel where you can watch his program. And that is youtube.com/hairtransplantmentor. Ring the bell, like this program as you're watching it. We really appreciate it. And don't forget to subscribe. And again, when you subscribe, ring the bell so you're notified that we are live. Joe, is there anything else you want to add?
Check out the new hairtransplantmentor.com. All new, redesigned from the ground up, and launched, ready for your perusal and inspection. Check it out, hairtransplantmentor.com.
Okay. Guys, we already said that, but I'm being passive aggressive apparently.
You are, but I'm reassuring people that it's a new website, which you didn't say. You just said the website.
By the way, it's a new website, first of all. By the way, Joe, it's kick-ass.
Thank you.
It really is.
Thank you.
And
worked very hard on it.
I would say that as we evolve the IHRS and as we move forward with what we're doing, I mean, Joe's going to be a very important part of everything that we're doing. And I would say that Bruce had a good thought, offering you $1,000 for a consultation. That was smart. I know you're not offering that, but maybe one day you should.
Well,
I'm just being honest.
Pay it, I might consider it. Yeah, it's like, I mean, I am a capitalist, right? But I'm not going to nickel and dime people for $60 here or $100 there for consultations. I think that's it doesn't make sense to me. And even like what he offered, even as gracious as it was, and as awesome as it was, is not something I'm prepared to do. So
okay, well,
if that doesn't tell you people about my ethics, I don't know what does about the way I look at this industry. So no one can say I'm a sellout.
Well, I have to applaud you for that because when the time is right, I will be taking everyone's checks who wants a consultation.
I'm not saying it won't happen in the future.
I'm just kidding.
Exactly.
I'm just kidding. Listen, I am. Well, first of all, I'm glad that we were able to do the program tonight, Joe. So I'm a little thrown off because your signal went out. But I'm glad that we were able to speak to our listeners. I think that it's important, both for us and for them, that we continue to do this at least once a week. So I'm moving forward. You know, again, I always talk about retiring. During this time, during this pandemic, I had a lot of time to think, and also during the the insanity that's happening in this country. A lot of time to think. And as we were moving forward with this conference, I had even more time to look at the industry and recognize that as bad as I thought it was, it might be even worse than I was thinking. As far as the attitudes and as far as the willingness or the people who actually do not want to see information being put out there for both physicians and for consumers. I don't understand it, but you know what? It's motivating. So guys, until next week, be strong, God bless, and thank you all so much for listening. Take care.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.